welcome to all of you to the second Healthcare Summit and Awards 2023, Innovation and Sustainable Solutions, the Future of Healthcare. I'm Anisha Nair Dhawan, I'm your host for the day, and I'm delighted to welcome all of you to this event. I've already requested you, and a small reminder once again, if you can please turn off your mobiles onto silent or onto airplane mode so that there are no interruptions during the course of the day today. In case you need to take calls, I request you to please step outside and take your calls. I request all of you to please settle down and clear the aisles. We are going to start in just a minute now. Our chief guest is here, and we are ready to welcome them. But a small request for all those who are still standing, please find a seat, please settle down, and please clear the aisles so that there are clear alleyways for our chief guest to come in. Our chief guest for the day, Dr. Vandana Talwar, Medical Superintendent, VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, the Government of India. Please put your hands together and welcome our dignitaries, our chief guest, Dr. Vandana Talwar. Let us start the proceedings of the day with the lighting of the ceremonial lamp, and we shall seek divine blessings at the start. I would request our esteemed dignitaries to please come forward to light the lamp. I would request Padma Shri Professor D.S. Rana, Chairperson, ASSOCHAM National Health Council, to please accompany our chief guest, Dr. Vandana Talwar, Medical Superintendent, VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India, to please light the lamp. I would request our other dignitaries to also please join in. Professor Dr. Rajinder K. Dhamija, Ms. Pushpa Vijay Raghavan, and Dr. Ashish Chaudhary. I request all of you to please join in to light the lamp. Shubham Kurutvam Kalyanam Arogyam Dhanasampada. Shubham Kurutvam Kalyanam Arogyam Dhanasampada. Shatru Buddhi Vinashaya Vipajyotir Namostute. Vipajyotir Namostute. Shubham Kurutvam Kalyanam Arogyam Dhanasampada. Thank you all for initiating this auspicious beginning to the conference. I would request all of you to please take your seats on the dais. Please put your hands together and welcome our esteemed dignitaries on the dais. Our chief guest, Dr. Vandana Talwar, Medical Superintendent, VMMC and Safdarjung Hospital. I would request Ms. Pushpa Vijay Raghavan, Director, Healthcare and Life Sciences, Sadhguru Management Consultants, to please come on stage. I request Padma Shri Professor Dr. D.S. Rana to also join our dignitaries on stage. I would request Dr. Ashish Chaudhary, Co-Chairperson, ASSOCHAM National Health Care Council, to also please be seated on the dais. And very shortly we'll be joined by Professor Dr. Rajinder K. Dhamija, Director, Institute of Human Behavior and Allied Sciences. He'll be here in just a few minutes. Thank you so much for joining us today. We are very grateful to have you with us. I would request Padma Shri Professor Dr. D.S. Rana, the Chairperson of the Board of Trustees, Sir Gangaram Hospital, and Chairperson, ASSOCHAM National Healthcare Council, to please present a bouquet to our chief guest, Dr. Vandana Talwar. India's healthcare industry is estimated to hit the $50 billion mark by 2025 with a compounded annual growth rate of 28%. While this might sound huge on an absolute basis, it still may not be enough to ensure healthcare access to everyone, especially those in rural India. The COVID pandemic has shown us that digital innovation can disproportionately leverage innovations and access the availability of healthcare to a larger population with remarkable outcomes. What we now need is a healthcare ecosystem that adopts digital innovation on an ongoing basis to reimagine public health systems and the way health services are delivered. The new normal in healthcare has already taken off. We have a thriving healthcare startup ecosystem coming up with cutting edge and affordable solutions. The world's largest health insurance scheme, fully financed by the government, the Ayushman Bharat PMJ scheme, and an ongoing campaign to provide digital health IDs to all Indian citizens to help hospitals, insurance agencies, and citizens access their healthcare records electronically whenever it is required. During the day today, we will discuss how we can build all these sustainable healthcare systems. I would now like to request Padma Shri Professor Dr. D.S. Rana, the Chairperson, Board of Trustees, Sir Gangaram Hospital, and the Chairperson, ASSOCHAM National Healthcare Council, to please address the audience and welcome everyone. Please put your hands together and welcome Dr. D.S. Rana.
Dr. Bandana Talwar, medical student of Sir Gangaram Hospital. Our guest from Hyderabad, Ms. Raghavan, Ms. M.S. Raghavan, who has written today a book which you are going to present after shortly. Dr. Dr. Ashish Chaudhary, co-chairman of our council, and Dr. dignitaries sitting in the audience from hospitals, from pharma industries, from media. I welcome you all for this ASSOCHAM conference concentrating on innovation and sustainability. Health for all is our fundamental right as envisaged in our constitution. But almost 75 years now passed, and we are still far away from it. The major issues are in the healthcare, affordability, and accessibility. Both these things have got a lot of verticals, like affordability has got out-of-pocket expenses, how many of us can afford in the country? And that is a problem for common man, or 70% population residing in rural area or below poverty lines. Affordability is also, that is being addressed partly now, at least by Prime Minister's very giant health scheme, that is PMJ Ayushman Bharat scheme. But even that scheme we could not utilize fully so far in over the last 4 or 5 years. So we all got to get together so that we can help that people utilize that scheme, and in future probably more people will be hooked in this scheme. Similarly, question of accessibility. Accessibility is also, there may be lack of healthcare facility in particular area, or the healthcare facility is very far away that in case of emergency you cannot reach it, or you cannot afford it. So these are very important issues. And over the last few years we have been addressing, actually especially during last 10 years, the present government is trying its best to address these issues, which has got a lot of components. In my view, biggest component today is lack of trained manpower, with medical doctors, technicians, nurses, or even paramedics. Until we sort out that problem, we will not be able to address this problem. Next problem comes that how do we make these services available to the rural population of the country where 70% people are living now. That is also a big challenge. But I am very sure that a lot of things are going on, digitalization, and as the topic today, something out-of-box thinking, innovative. That is the slogan of this century. And sustainability. These are two things, these are two steps which are going to address this problem. I hope so that during this Amrit Kal, Amrit Mahotsav, during next 25 years, I think we should be able to address this issue. And I feel that during the next 5 years, after 2025, there will be really dramatic progress in the field of healthcare industries. All those steps which have been taken, especially in digitalization and other things, they are going to bear fruits in next 5 years. And all of us required to be very active in getting this aim achieved. With these few words, I would not like to speak much on this health, because a lot of these things are being addressed by the leader in their fields in today's conference till evening. So I thank you all and welcome you all to this conference. Thank you.
Thank you, Dr. Rana. We are very delighted to welcome Professor Dr. Rajinder K. Dhamija. I would request Dr. Ashish Chaudhary, Co-Chairperson, ASSOCHAM National Healthcare Council, to please welcome him with a bouquet. Thank you so much, sir, for coming here and gracing us with your presence. We look forward to hearing from you too about your vision for India's healthcare system. I would now like to request Ms. Pushpa Vijay Raghavan, Director, Healthcare and Life Sciences, Sadhguru Management Consultants, to please address the audience in this special address. Please put your hands together for Ms. Pushpa Vijay Raghavan.
Good morning. We're just going to wait for a few seconds to have some slides up. You think we're going to get some slides? Thank you. कहाँ पे? हाँ लेकिन कहाँ पे स्लाइड्स आए नहीं ना? हाँ ठीक है आने दो. प्रेजेंटेशन आएगा. हाँ लेकिन पीछे स्क्रीन पे आ रहा है? Okay, excellent. Thank you. Okay, always a pleasure to be back at ASSOCHAM Healthcare Summit. As usual, a great convergence of stakeholders across healthcare delivery, pharmaceuticals, enabling ecosystem partners, and of course, policymakers. I couldn't be more optimistic about where we stand and where we're going with the healthcare ecosystem in India. I think the overall economic context is the first fundamental element driving it there. I mean, we continue to be the single largest growing economy in the world amongst large economies today. There's also the advantage of having that backbone of digital engagement, so internet penetration and mobile penetration. We have more than 600 million mobile users and more than 1 billion internet users in the country, which provides an opportunity to transform the healthcare ecosystem in a way we've not thought of before. But when you look at, the actual need for healthcare transformation, and Dr. Rana has already emphasized that, and I'm sure my fellow panelists will allude to it as well, is the need to address in an accelerated way this continuing challenge of resource scarcity, number of doctors per individual, number of beds per individual. Both are well below what it should be, and we can't bridge it without integrating technology in an innovative way. But also when you combine that with the disease profile, continuing to be this double helix of communicable diseases and non-communicable diseases, that again expands the opportunity of how we can leverage innovation to transform healthcare. But how are we paying for care? In fact, there was a document on the missing middle that Niti Aayog brought out. So there is a clear policy thinking around out-of-pocket expenditure and payment for care, even beyond that 40%, which the PMJ program covers in a landmark way. So when you look at the private healthcare insurance today, it includes both what companies are providing to individuals, as well as what individuals are buying for themselves and their families. And that coverage today is about 9% of the population. Right? And it includes a fair share of about 7.4 crore individuals covered by corporate-provided insurance to their employees, and about 4.2 crore individuals who are covered by self-paid insurance for themselves and their families. Now, while this looks like a smaller number in terms of 9%, it's actually doubled between 2014 to now. So there is a significant growth momentum, and it continues to expand. Companies have, in fact, post-COVID, only enhanced the focus on seeing healthcare as a benefit that employees truly value. So the level of corporate focus in terms of insurance as a benefit, but also individual focus on making sure that there is protection for themselves and their family has gone up. So the willingness to spend is driving this. The economic power, economic growth is driving this growth. And we are going to see this top 9% go to 20-25% in the midterm. You combine that with the government focus on universal healthcare, which is clearly the strongest driving force today in terms of healthcare delivery. We have two ends of the spectrum coming together in terms of both the momentum in the high end of care, as well as the momentum around enabling accessibility and affordability where it is most needed. Right? So the Ayushman Bharat PMJ scheme, interestingly, is also focused significantly on the primary care, and we're seeing our PHCs and CPHCs getting transformed into more holistic health and wellness centers, with about 150,000, 150,000 of those already achieved by December 22. But when you're looking at the secondary care, this is where the opportunity again for private sector to get involved in publicly funded care delivery is significant. Because if you look at the numbers, take an indicative example of a state like Madhya Pradesh, for instance, while you've got the empaneled hospitals not being very different between public and private facilities, so about 508 private facilities and about 475 public facilities, when you look at the quantum of care delivered, private sector has achieved a lot more there, with about 581 crores of value reimbursed to private sector versus about 167 crores in the public sector in the same few months from April to August 2022. So that's just indicative data, but about 28,000 private hospitals are empaneled, and hence there is this significant and expanding opportunity for private sector to participate in publicly funded care. But which also takes us back to the question again of cost optimization, efficiency, throughput, combined with care outcomes, which calls for, again, transformative thinking. And on the same theme of the landmark public coverage program and the goal of universal healthcare, consequently, we've seen government spending on health go up. And if you look at the total health expenditure, the share of the government health expenditure in that has gone up to about 40-odd% now, 41% from what it was in terms of 28% in the 2013-14 horizon. Now, the private sector is staring into an excellent opportunity in terms of providing care in a with a much expanded scope, paid for both by government as well as individuals out of pocket and private insurance. But how do we fund that growth? And that's where, when you look at the funding that's come to the private sector, even the private equity venture capital investments have been steep. When you look at a 10-year period of about 2013 to 23, we see about $10 billion that have been invested in Indian healthcare delivery in terms of private equity investments. But at the same time, even large transactions in terms of M&A have been active. So there has been focus on consolidation. Larger groups have been looking at acquiring smaller groups, bringing in overall efficiency in operations, expanded scope of operations. So there has been both capital from corporate investors looking at growth, but also private equity funds, which have been actively engaged in the sector, continue to seek opportunities. In fact, the last panel today, we are going to be talking about the funding fuel being available, being easy to access, and coming in to further fuel and enable actualization of that expanded capacity that we're seeking today. I keep going back to this theme of digital because that is our theme for today. But while we're talking of innovation, I think, again, fundamentally the drivers are so strong, tailwinds are strong, which is why that pull force is what's pulling in this whole widening funnel of innovations in the country, which in fact is a factor also driving growth because you have a need. You're seeing the solutions get developed in the country by innovative ventures in the country. And thus, there is this opportunity for both to come together in a very symbiotic way. The policy stimulus, and I'll go to that in a minute, is again being a great propelling factor in terms of having the ecosystem for these innovations to take off. And like we've discussed, the need in terms of evolving disease profile and glaring capacity gaps. I've been in the G20 Health Working Group meetings, and again, it's extremely encouraging to see digital health as one of the 3 themes prioritized. The other one being pandemic preparedness as well as cooperation in the pharmaceutical sector. So it is a theme that India's G20 presidency has brought to the fore as one that's critical. We've just seen the final health minister's outcome come out 2 days ago from Gandhinagar. Very, very emphatic that countries need to come together to accelerate this transformation. I had the opportunity to chat about this with Dr. Vandana some time back, but COVID did serve as a stimulus in terms of initial adoption of some of this. While the innovations are sitting around, the impetus before COVID for adoption of the innovation was much lower. COVID had a need, the innovations found their way in. So while it's not the same level of use today, we do see a continued engagement in terms of digital innovation and the overall clinical ecosystem, but also the consumer appetite. Both have gone up. And as an example, a leading maternal child health institution that in fact during COVID got into doing a certain number of antenatal consultations through a teleconsultation model, continues to do so today. So we've seen a truly sustainable behavioral change come in terms of both institutional perception of where all this fits in, clinical adoption, but also consumer patient adoption of innovations. I can't not talk about the policy element because the policy environment has been, for one, so rapidly evolving, and there have been several progressive steps that have come together in terms of where we are today, and there are going to be more coming in terms of policy stimulus. The initial ones were much broader when you look at things like the National Health Stack or the AI strategy that came through. But when you look at the 2020 reactive measure of the telemedicine guidelines that came out right after COVID hit us, it was extremely significant step in terms of creating a legal framework that gave clinicians comfort to engage in consultations virtually, which we didn't have before. But that, again, has been followed up with critical elements such as the digital health mission. And more importantly, I think this year, what we've seen in terms of the incentives come through for digitization, that has been extremely exciting because this is structurally a very well-conceived mechanism where we are incentivizing institutions as well as solution providers based on number of digital records created. So this is an excellent policy stimulus to trigger digitization and thus create the backbone for innovation to be adopted at scale. And finally, the last element we're going to touch upon is a critical focus area for the overall sector as we're looking forward in the future. India is committed. We've made our nationally determined contribution targets. We put it together that by 2070, we're going to be net zero. So there is an onus on every part of the Indian ecosystem to ensure this focus on sustainability, foster energy efficiency, and the healthcare delivery sectors no behind. We've already started our move towards looking at greener buildings, but also biomedical waste management. There's also thinking on teleconsultations, actually bringing down the carbon footprint in terms of patients commuting to hospitals. So there's scope across the whole continuum of care to really bring in elements around sustainability. And that journey has just begun, and there's an exciting phase in front of us. And so I think standing on the cusp of a transformation, it's really on us to accelerate the pace of adoption, accelerate how we pursue these sustainability goals, but really leverage what is today a very exciting ecosystem to deliver care to a much wider set of patients with better outcomes and with world-class quality in terms of care we deliver. Thank you.
Thank you, ma'am, for giving us an overarching view of digital innovations and sustainability in healthcare. I would now like to request Professor Dr. Rajinder K. Dhamija, Director, Institute of Human Behavior and Allied Sciences, Government of NCT of Delhi, to please address the audience. Please put your hands together for Professor Dhamija.
Good morning to all of you. My esteemed colleague and friend, Dr. Vandana Talwar, Chief Guest of this inaugural session, Padam Shri Dr. D.S. Rana, Chairperson, SHM, National Healthcare Council, Dr. Ashish Chaudhary, Dr. Pushpa, friends, colleagues, at the outset, I must express my gratitude for having me this morning for an important session of SHM Second Healthcare Summit and Award Ceremony. I'm delighted to be here, and I bring my greetings from Institute of Human Behavior and Allied Sciences, which is a national premier neuropsychiatric hospital of Delhi, the one in North India, which is the largest neuropsychiatric hospital in terms of numbers of OPD in Asia. I'm privileged to be the member of the jury for this award function, and with extensive deliberations, the award winners are here, and I must congratulate them for their hard work and bringing healthcare to the masses, and I hope that they will continue to serve the society to bring the Indian healthcare system to affordable, available, and accessible to the common man. Having said that, we have achieved a lot in last 75 years. We now, as a hub of vaccination industry, we provide 60% of all the vaccination to the world. We provide 40% of all generics to the US in the whole country of United States of America. We also provide 25% of all generics in the UK. And in fact, we provide 2/3 of all antiviral drugs to the world. So that is what we have been in the industry, which have been not only serving the country, but also outside the country. And we have seen in the COVID-19, the way the India was leading in the forefront for vaccine production, as well as for the dissemination to the whole of the world for the unprecedented human tragedy or human crisis, humanitarian crisis in the century. So public and private health sector have a synergistic action actually. We have a $50 billion healthcare industry in India, which is growing at a very fast and rapid pace. In next coming years, we see a lot of things happening. Dr. Pushpa has already alluded to many of the things. In terms of infrastructure and manpower, since I have been working in Australia for many years before coming back to India, so the healthcare system in geopolitical areas in different parts of the world has a different dynamics. We have our own achievements, they have their own achievements. We spend 4 to 5% of our GDP in the country on health, including private and public. Countries like Australia spend 11 to 12% of their GDP. Countries like Switzerland spend 17% of their GDP on the healthcare, total healthcare in the country. So we need to come up having that lead. The things have been moving very fast in last few years. In last 10 years, we have increased our per capita expenditure on health. The insurance sector is coming in a big way. Digital health coming is in a big way, and recently the Ayushman Bharat Digital Mission, which Dr. Pushpa just alluded to, the incentive program for bringing ABHA into the hospitals, up to 4 crores of incentive from the National Health Authority, so that all the health records can become electronic by inducing the ABHA, the the QR-based app, which will have the electronic health system for all the country men. In terms of manpower, we are still lagging behind since I am the neurologist by training and I practice as a neurologist most of my time. And I'm also heading the Mental Health Institute of the country, Premier Healthcare Institute. We have only 3,000 neurologists. We need thousands and thousands of neurologists, at least 5 times than with what we have today. We have increased our capacity in last 5 years to about 1,000 new neurologists every year, but still we are lagging behind because people are moving across the globe to serve other countries. So there is a dynamic equilibrium. So people are coming into the system, people are living in the system. We have only 9,000 psychiatrists. We need 30,000 psychiatrists. Last week, a delegation from Japan came to my hospital. Japan has a population of 12 crores, 120 millions, and they have 20,000 psychiatrists. We have 140 crores, 1.4 billion. We have only 9,000 psychiatrists. We have only 3,000 clinical psychologists. We need more than 10,000 clinical psychologists. We as a society have a lot of stigma. We have a very poor mental health literacy. We need to destigmatize. We need to increase our health literacy or mental health literacy. These are the problems which I am alluding to as industry leaders to take attention and see how can we overcome these challenges in our healthcare system. There are many challenges. We have achieved a lot, but we still have a long way to go to have our Amrit Mahotsav, Amrit Kal in next 25 years to have healthcare to the farthest corner of the country, to the marginalized people, to the all-in-one which we deserve as a human being. We need to produce human capital. Human capital is a very, very important for any developing country or any developed country. To make it happen, we need to have human capital in terms of healthcare, not only in the field of medicine, but also in the terms of economics, so that productivity increases, the people who are living are healthy, and they contribute to the society and to the country and to the nation building. These kind of activities, these kinds of initiatives by SHMs go a long way. I have been involved with SHM for last 2 years for their illness to wellness program, where we have more than 100 webinars moderated by none other than Dr. Rajesh Keshri, who is sitting here. And we have had many, many informative, educative programs for not only for the people who are working in the industry, but also for the layman. And I must congratulate SHM Health Council, the Digital Council, Mr. Anil Rajput, the head CSR, and all his team, including Mr. Taneja and Mr. Sandeep, who have been working very hard during COVID times, during hard times. And I urge you to give a big hand to all the SHM team for bringing the healthcare to the people at the doorstep of people. With these remarks, I have a lot of things to tell, but still we are running already behind the schedule. Finally, I would like to thank the organizers for having me and giving me this opportunity to interact with you. There is a tea time where we can interact individual one-to-one, and I'm happy to be here once again. Thank you very much. Namaskar. Jai Hind.
Thank you, sir. More than 50 lakh healthcare professionals and thousands of institutions clock in long hours daily and put in their blood, sweat, and tears to save lives and bring relief and comfort to many, many patients. In a bid to recognize, honor, and applaud exceptional healthcare professionals and institutions, today we will be presenting the second Healthcare Awards. I would first like to request a huge round of applause for our jury members who have painstakingly gone through all the nominations received and selected winners in each category. I would like to request the jury members, some of them are already on stage, I would request the others to also please come in, and I will tell you who our jury members are. Our esteemed jury members include Dr. D.S. Rana, the chairperson of Sir Gangaram Hospital, Professor Rajinder K. Dhamija, Director, Institute of Human Behavior and Allied Sciences, Dr. Sudhir Kalan, chairperson, Institute of Minimal Access, Sir Gangaram Hospital. I request Dr. Kalan to please come on stage, and a big round of applause for Dr. Kalan. On our jury, we also have Mr. Pankaj Jory, Director, NABL, Dr. Atul Mohan Kochhar, CEO, NABH, Dr. Sunil K. Khetrapal, Director, AHPI, and Ms. Pushpa R. Vijayaraghavan, Director of Sadhguru Consultants. A big round of applause for all our jury members. They have done painstaking work to pick up the winning entries today. So now I would request our chief guest and our jury members and our esteemed dignitaries on stage to please come forward to give and present the awards to the winners. But before we do that, we are very grateful to our jury members for taking the time out and picking up the winning entries. So I would request Mr. Sandeep Jain, Director and Head CSR, to please come on stage and present a memento to our jury members who are present on stage. We are very grateful to you for taking the time out. From your busy schedule, you're all very busy people, but you've made the effort to show that regard for these individuals and institutions doing such a great job. So I request Mr. Jain to please present a memento to Dr. Rana. A memento for Professor Dhamija. A memento for Ms. Vijayaraghavan. And a memento for Dr. Kallan. I would request Dr. Vandana Talwar, our jury members and our esteemed dignitaries on stage to please come forward to give away the awards that we will now be giving in the second Healthcare Summit and Awards. So let's start with our first category, which is the Best Company for Technology Innovation in Healthcare. And the second runner-up in this category is Echo India. A huge round of applause for Echo India and the team of Echo India. I would request the representative from Echo India to please come on stage to accept this award. Congratulations. The first runner-up in the category of Best Company for Technology Innovation in Healthcare is Cadila Pharmaceuticals Limited. Please put your hands together and welcome the winning team of Cadila Pharma Limited. Congratulations. And the winner in the Best Company for Technology Innovation in Healthcare is Poly Medicure Limited. Congratulations to Poly Medicure. The next category is Best CSR Excellence in Healthcare. And the second runner-up is BD India. Congratulations to the team of BD India. And we request you to please make your way up to the stage to receive your award. The first runner-up in the category of Best CSR Excellence in Healthcare goes to Metropolis Healthcare Limited. Congratulations to the team of Metropolis Healthcare Limited. Please keep the round of applause going for the first runner-up in the Best CSR Excellence in Healthcare category. We now move on to the category of Best CSR Excellence in Healthcare Implementing Organization. And the second runner-up in this category is IndoCount Foundation. Big round of applause for the winning team, the second runner-up, IndoCount Foundation. Congratulations to the winner. The first runner-up in the Best CSR Excellence in Healthcare Implementing Organization category goes to Echo India. Congratulations to the team of Echo India. And the winner in this category is Smile Foundation and SBI Cards and Payment Services Limited. They are the winners in the category of Best CSR Excellence in Healthcare Implementing Organization. So big round of applause for the winners, Smile Foundation and SBI Cards and Payment Services Solutions. The next category is the Best Diagnostic Company, and the first runner-up in this category is Biogenics Inc. Private Limited. Congratulations to the team of Biogenics Inc. Private Limited. We're not hearing the appreciation from the audience. Come on, a big round of applause for the winners. The first runner-up in the Best Diagnostic Company. Congratulations, and the winner in the Best Diagnostic Company category is Metropolis Healthcare Limited. Congratulations to the Metropolis team. Once again, we'd like to invite you onto the stage to receive the recognition in the category of Best Diagnostic Company. Congratulations to the Metropolis team. Our next category is the best group of hospitals, and the winner is Sankara Eye Foundation India SKKMT. Congratulations to the team of Sankara Eye Foundation. The next category is Best Hospital for Adoption of Green Energy. And the winner is UN Mehta Institute of Cardiology and Research Center. Congratulations to the team of the UN Mehta Institute of Cardiology and Research. They have shown us the way for adoption of green energy. A big round of applause for the team that is making its way up to the stage. Our next award is for the Distinguished Doctor of the Year in Orthopedics, and the winner is Dr. Ashish Chaudhary. The next award is for Distinguished Doctor of the Year in Cardiology, and the first runner-up is Dr. R.N. Kalra. I think Dr. Kalra is not here. We shall send him his award. The winner in the Distinguished Doctor of the Year in Cardiology category is Dr. Chirag P. Doshi. Please put your hands together for the winner, the Distinguished Doctor of the Year in Cardiology, Dr. Chirag P. Doshi. I think the representatives are still coming on stage to receive the honor. Please keep the applause coming in. They are winners who are on stage. Our next category is Most Promising CEO of the Year in Healthcare, and the second runner-up is Mr. Ravi Tomar, CRL Diagnostic Private Limited. Huge round of applause for our second runner-up, Mr. Ravi Tomar. And the first runners-up is Ms. Chandra Ganju, Trivetian Healthcare Private Limited. And the winner in the category of Most Promising CEO of the Year in Healthcare goes to Wing Commander M.K. Bose, Seven Hills Healthcare Private Limited. Huge round of applause for Wing Commander M.K. Bose. Our next category is Emerging Healthcare Brand of the Year. And the second runner-up goes to Organon. Congratulations to the team of Organon. Please give a huge round of applause to this brand, Organon, the second runner-up for the Emerging Healthcare Brand of the Year. The first runners-up in this category is Sri Satya Sai Sarla Memorial Hospital, SSSSMH. A round of applause for our winners who are making it from the back of the hall. So please keep your applause coming till the time they're on the stage. Let's not be stingy with the applause because all of these are achievers, individuals, institutions, and they do deserve the recognition they are getting. Please keep the round of applause going. And the winner in the category of Emerging Healthcare Brand of the Year goes to Akash Healthcare. The next category is Best Hospital for Patient Safety and Care. And the second runner-up is Kaveri Hospital, Salem. Please keep clapping for our second runner-up in the Best Hospital for Patient Safety and Care. Congratulations to the team of Kaveri Hospital, Salem. The first runner-up in the Best Hospital for Patient Safety and Care goes to Rajagiri Hospital. Congratulations to the team of Rajagiri. We are seeing a couple of fine ladies making their way up to the stage. So please keep the applause going for the first runner-up in the Best Hospital for Patient Safety and Care. Very commendable to see hospitals care so much for their patients and ensure that they stay comfortable. And the winner in this category, Best Hospital for Patient Safety and Care, goes to HCG Cancer Center, Vadodara. We have the representatives of HCG Cancer Center, Vadodara on stage. Please give a huge round of applause to the winner of the Best Hospital for Patient Safety and Care. In the category of Best Multi-Speciality Hospital, the first runner-up is Felix Hospital. Congratulations to the team of Felix Hospital. The team of Felix Hospital is making their way up to the stage, I request all of you to please welcome them with a huge round of applause. They're the first runner-up in the Best Multi-Speciality Hospital category. And the winner in the Best Multi-Speciality Hospital category is Manipal Hospital, Guntur. Congratulations to the team of Manipal Hospital. I request all of you to continue to encourage them and keep the applause going as they come up the stage to receive their award. Congratulations to the team of Manipal Hospital. In the category of Best CSR Excellence in Healthcare, the winner is Maruti Suzuki India Limited. Congratulations to all the winners. I would request one team member of each of the winning team to please come on stage with your plaque for a group photograph with our esteemed jury members on stage. So just one member please, because as you can appreciate, the space here is limited. So one member of each team is requested, of each winning team is requested to please come on stage along with your award for a group photograph. And to all those who are sitting by, your teams have won, your compatriots have won, so keep the applause going. They're all winners on the stage here. Round of applause for all the winners on stage. Congratulations to all the high achievers in the healthcare industry. Thank you to all the award-winning teams. I request you all to please take your seats off the stage. We will now move on to the release of the knowledge paper, which ASSOCHAM is doing in association with Sadhguru Management Consultants. This knowledge paper gives you an overarching view of India's healthcare industry and the opportunities that are there in this industry and what can be achieved through digital innovations. So I would request all our esteemed dignitaries on stage to please release this report. Thank you all for releasing this report. We are grateful to you. And I request all of you to go through this report. It will be quite, it will help you expand your knowledge about the sector. I would now like to invite Dr. Vandana Talwar, Medical Superintendent, VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India, to please address the audience. We are eagerly awaiting a few words from you. Please put your hands together and welcome Dr. Vandana Talwar.
A very good morning to all. Respected Professor D.S. Rana, Chairperson Board of Trustees, Sir Gangaram Hospital and Chairperson ASSOCHAM National Healthcare Council, Professor R.K. Dhameja, Director Institute of Human Behavior and Allied Sciences, Ms. Pushpa Vijayaraghavan, Director Healthcare and Life Sciences, Sadhguru Management Consultants, Dr. Ashish Chaudhary, Co-Chairperson ASSOCHAM National Healthcare Council and Managing Director of Aakash Healthcare. It's my honor and privilege to be standing here today as chief guest before you to discuss a topic of immense significance that lies at the intersection of human ingenuity, technological advancement, and well-being of our global community. It is a topic that encapsulates our aspirations for a brighter future. Innovations and sustainable solutions, the future of healthcare. As we all know, healthcare occupies a pivotal role in the development of India today. Honorable Prime Minister Modi ji has stated, "Good health is the foundation of human progress and prosperity. The future belongs to a society investing in healthcare." As we navigate the 21st century, we find ourselves at the brink of a new era in healthcare, driven by groundbreaking innovations and a pressing need for sustainable solutions. The health of our planet and well-being of its inhabitants are intrinsically connected, and the strides we make in healthcare innovation will significantly impact the quality of healthcare in the future generations to come. Over the past few decades, we have witnessed enormous medical advances in therapeutics and diagnostics, including medical imaging techniques that have revolutionized the way we diagnose, treat, and prevent diseases. As we peer into the future, the potential for innovations is even more awe-inspiring. From the invention of penicillin to the development of gene therapy for amelioration of formerly untreatable genetic disorders, innovation has been the keystone for transforming medical care for the masses. Today, technological advancements have provided into our hands the policy of creating a new digital ecosystem that can not only enhance accessibility and efficiency of healthcare delivery, but also make it more cost-effective and pave the way for universal health coverage in India in an efficient, inclusive, affordable, timely, and safe manner. The Ayushman Bharat Digital Mission aims to develop the backbone necessary to support the integrated digital health infrastructure of our country. It will bridge the existing gap among different stakeholders of healthcare ecosystem through digital highways. The Ayushman Bharat Digital Mission has achieved a significant milestone by issuing more than 50 lakh digital tokens for a quick and queueless OPD registration through its scan and share service. The key features of which are teleconsultation and electronic medical records. Telemedicine, as you all know, this innovation allows patients to consult with healthcare providers remotely, reducing the need for in-person visits and increasing access to medical care, especially in rural and underserved areas. It also reduces transportation costs and carbon emissions associated with travel to the healthcare facilities. Electronic health records digitize medical records, making patient information easily accessible and reducing the need for paper documentation, resulting in improved efficiency and reduced waste. It also enables seamless sharing of patient data among healthcare providers, leading to better coordinated and more effective care. Artificial intelligence, another technological marvel, is poised to reshape healthcare. Machine learning algorithms can analyze massive amounts of medical data, aiding in early disease detection and treatment recommendations. They can predict outbreaks, optimize hospital operations, and even assist in surgical procedures. Recently, we saw amazing strides in the ability of artificial intelligence-based analysis of retinal scans to predict coronary artery disease in patients. These innovations not only enhance the accuracy of medical practice, but also free up valuable human resources for more complex tasks that demand empathy and critical thinking. Today, robots are assisting surgeons in complex procedures, ensuring greater precision, flexibility, and control. India is emerging as a world leader in teaching and training of robotics in healthcare. Robotic renal transplant was shown live from Safdarjung Hospital to 52 medical colleges and 20 different countries on the NMC portal recently, a great use of technology indeed. Mental health innovations. Since the launch of Together for Good Mental Health in October 22, more than 2 lakh calls have been received on Telemanas Helpline, a Government of India's initiative, leveraging the power of technology. The government is providing access to quality and affordable mental health care for all. Coming to preventive health technologies, the development of innovative tools and technologies for preventive care, such as early cancer detection screenings, genetic testing, and personalized risk assessments, can lead to early detection and intervention, saving lives and reducing healthcare costs in the long run. Take, for instance, the field of genomics, the study of an individual's entire genetic makeup. Thanks to advances in genome sequencing technology, personalized medicine is now becoming a reality. Tailoring treatment to an individual's genetic predisposition promises effective interventions with fewer side effects. The next generation sequencing facility has recently been started at Safdarjung Hospital, which shall be of great use for diagnosis, prevention, and targeted therapy in cancer patients and those with genetic disorders. Stem cell therapy is another magnificent game changer in medicine. Stem cell engineering opens a new path to regenerative medicine, providing a new paradigm in tissue regeneration. The best defined and most extensively used stem cell treatment is hematopoietic or blood. For example, stem cell transplantation. I'm happy to announce that we have discharged our first bone marrow transplant patient ever done in a central government hospital just yesterday. Wearable devices like fitness trackers and smartwatches enable individuals to monitor their own health parameters continuously. Remote monitoring technologies allow healthcare workers to track and manage chronic conditions more effectively, thus reducing the need for frequent office visits and hospital stays. Public-private partnership. This is the next growth catalyst for the healthcare industry in India and will lead to a win-win situation for all stakeholders. We at Safdarjung Hospital are already working with this concept in our Sports Injury Center and the Super Speciality Block. In addition, the government has taken up numerous initiatives using information and communication technologies for improving efficiency and effectiveness of the public healthcare system, which includes launching of Sugam, that is bringing government closer to the citizen through a simple way for service delivery and grievance redressal, and the online registration system, in addition to many other things. Yet, as we embrace these innovations, we must also consider their environmental and societal impacts. This is where the concept of sustainability comes into play. Healthcare systems around the world generate a significant carbon footprint, from energy-intensive medical equipment to the disposal of single-use plastics. As we look into the future, the imperative for sustainable solutions becomes clearer than ever before. Coming to the green healthcare facilities, first and foremost, we must design healthcare infrastructure that minimizes environmental impact. Energy-efficient hospitals, reduction of waste through recycling and reusability, and the adoption of renewable energy sources all play a crucial role in creating a sustainable healthcare system. Rainwater harvesting and incorporating green systems, green spaces will further improve patient well-being and recovery. New techniques and technologies are being developed to improve vaccine and drug delivery, such as microneedle patches, inhalable vaccines, and targeted drug delivery systems. These innovations can enhance efficacy, reduce pain, and minimize waste associated with the traditional administration methods. Promoting healthy eating habits and implementing sustainable food practices in healthcare facilities can improve patient health outcomes and reduce the environmental impact of food production. These initiatives can include sourcing local and organic food, reducing food waste, and offering nutritious and sustainable meal options to patients. To conclude, I would say the future of healthcare is one of boundless possibilities. Innovations driven by science, technology, and human creativity are reshaping the medical landscape. But let us not forget the symbiotic relationship between innovation and sustainability. As we forge ahead, we must ensure that our progress is rooted in practices that benefit both the health of individuals and the health of our planet. It is our responsibility to shape a future where the marvels of medical progress harmonize with the resilience of sustainable solutions. Let us advocate for policies that encourage eco-friendly healthcare policies, while also ensuring that these innovations are accessible to all, regardless of the socio-economic status. We are committed to improving the quality of healthcare to meet the health-related targets of the Sustainable Development Goals, as India aims to achieve universal health coverage by 2030. Sabka Saath, Sabka Vikas, Sabka Swasth. Honorable Prime Minister is reaching the last mile by significantly increasing investment in healthcare, thus improving India's overall healthcare landscape. We, as medical professionals and citizens of the country, will all play a crucial role in strengthening the healthcare ecosystem to create a healthy and prosperous India. The mantra is Seva Paramo Dharma. Our actions today will determine the quality of healthcare for generations to come. Let us embrace the future with a dual commitment to innovation and sustainability. Last but not the least, I'd like to congratulate all the awardees. My heartiest congratulations to the organizers. You've done an excellent job, and let us keep going ahead, doing the good work, and spreading happiness around us. Thank you very much.
Thank you, ma'am. I would now like to request Dr. Ashish Chaudhary, Co-Chairperson, ASSOCHAM National Healthcare Council and Senior Consultant and Head, Department of Orthopedics and Joint Replacement and Managing Director at Akash Healthcare, to please give the concluding remarks and the vote of thanks.
Thank you so much. At the outset, I'd like to welcome all our dignitaries on the dais, Professor Rana, Dr. Vandana, Dr. Dhamija, and Ms. Vijay Raghavan from Sadhguru Consultants. Also, I would like to thank ASSOCHAM for giving me this opportunity to be a part of this esteemed gathering. not only for attending the fantastic day-long program which has been curated, keeping in mind various aspects and facets of healthcare delivery here in India, but also bring all of us from varied background, like from government hospitals, private trust hospitals, management consultant groups, and also private hospitals. So we have got representation from almost all categories. Only then we can have a genuine opinion, feedbacks, issues which revolve around sustainability in various verticals. The problems faced by government facilities may be very different from what private healthcare institutions are facing these days. So that's one great job the SHM leadership, including Sood Saab and Sandeep ji, have curated well. I was looking through the program and found a lot of mention about the green sustainability, green healthcare, use of technologies all over the place, right from the COVID times, and also how to scale up the operations. And in our special address and the welcome speech, we heard about the perspective from a private trust hospital, from a management consultant, and two of the leading government facilities. So coming from a private background and starting as a lone clinician, and if I compare the time when we started doing post-graduation and practice versus the today's time, the sea of change in terms of sustainability also, in terms of challenges which a private healthcare institution faces. Many a times we come across institutions which are private institutions which are run by clinicians, doctors, the family of doctors, but they're not able to sustain for a very long time, and they are looking for, corporate hospitals and many other investors to invest and bail them out. That really pains. So I feel that innovation has to come up, sector-wise, has to come up, which should be providing answers to that particular vertical. In India, more than 70% of care is still managed by private institutions. So I think there is no way we can ignore the sustainability of private healthcare in India, whether it is the simple private clinics of the various doctors from various specialities, whether it is allopathic, Ayurvedic, homeopathic. Everybody is coming on the same page. The sheer size of population demands more and more doctors. Even today, we are short of so many neuropsychiatrists, compared to Japan and many other developed countries. And same story holds for cardiologists and all other super specialists. There are a handful of people for such a large population. So the scope for growth in all verticals is phenomenal, is endless. The only thing is, how do we reach out to more and more people? COVID gave us a lot of innovative solutions when we were forced to be sitting at home, yet we wanted to get the basic healthcare, not only for COVID treatment, but also for many other prevailing chronic diseases. So that actually kick-started the entire technology evolution in healthcare. So many startups come up every day which focus on one or the other aspect of sustainability and bring about innovative solutions to healthcare. Unfortunately, most of them, they may not survive, and very rarely somebody would go up to a unicorn level. But each and every one is trying their level best, especially in South India, Bangalore, Hyderabad. They are the hub of creating such solutions, and many of them have come up to a global standard. Having said that, this innovation and sustainable solution, this pertinent topic, burning topic for last many years, I've attended many conferences, workshops where people are talking about this, but the practical implication requires, not just a one day or a 20 minutes panel discussion. It requires brainstorming across verticals, day long, week long, and month long innovations, and trying hard and going back to and fro. Even as simple as implementing good HIS in a hospital still remains a challenge for most of us. We have got our own limitations of operating. We have got own mindset of senior clinicians. We have got a roadblock between management and clinicians. So somewhere, these are the areas where innovation has to be brought in and it has to be solidified. Apart from solutions of technology, I think we are also facing challenges in terms of doctor-patient relationships. There also we feel that some factors which are way beyond technology, whether it relates to the a better communication between the patient and the team, or it relates to being more empathetic towards the treatment, even while communicating with the patient and not just focusing on the numbers and filling up the forms on telemedicine. So these are the areas which I feel are a newer challenge in the last few years, where the trust between the doctors and or the hospitals and the patient is at all-time low. Even my colleagues would, they get their attendees or their patients, they would also start behaving like a attendant rather than, even if we have worked together, if I advise a surgical treatment, they would also go back for second or third consult. So that kind of area, which is a very sensitive issue for each one of us, whether it's a government hospital or a private hospital, the trust building has to be taken up more seriously. I mean, technology and greener healthcare, everything is good, but if the patient doesn't trust that facility or the doctor or the hospital, or the building is just a piece of land, and it's not going to survive unless the patients starts pouring in with their all trust onto the system. So, not going too much into this because I am standing between you and the tea break. So I would stop here with giving all 5-star to ASSOCHAM team, and also to thanking all the leadership team sitting on the dais who have spared the morning time and come here and gave their thoughts on the sustainability in healthcare. And thank you all the audience for sitting so patiently, and hope to see you and interact more and more during the tea break sessions. Thank you so much.
Thank you. I would now like to request Dr. Rana to please present memento to esteemed dignitaries for coming here and sharing their thoughts and vision with us. I request you to please present a memento to Dr. Vandana Talwar, Medical Superintendent, VMMC and Safdarjung Hospital, Ministry of Health and Family Welfare, Government of India. I would request Dr. Rana to please present a memento to Professor Dr. Rajinder K. Dhamija, the Director at IHBAS, Government of NCT, Delhi. I would request Mr. Sandeep Jain, Director, ASSOCHAM, to please present a memento to Dr. D.S. Rana. He is the chairperson of the ASSOCHAM National Healthcare Council and the chairperson of the Board of Trustees, Sir Gangaram Hospital. I would request Mr. Jain to also present a memento to Ms. Pushpa Vijay Raghavan, Director, Healthcare and Life Sciences, Sadhguru Management Consultants. And a memento for Dr. Ashish Chaudhary, Co-Chairperson, ASSOCHAM National Health Council and Senior Consultant and Head, Department of Orthopedics and Joint Replacement and Managing Director at Akash Healthcare. ASSOCHAM would like to thank all our dignitaries on stage for coming here, sparing time from their busy schedule and sharing their thoughts, their views and their opinions with the audience here, and of course encouraging all the award winners of the day. Big round of applause for all our dignitaries. Thank you all for joining us. We are unfortunately not going to go in for the tea break because we're running really behind time. So we're going to move on to our next session. I would request our dignitaries to please take their place off the stage so that we can invite our next set of speakers in our next session that is getting started. Okay, one group photograph before we invite the next set of speakers. We are going to continue with the next session. I request all of you to please remain seated in your seats and please clear the aisles so that our dignitaries can leave without interruptions. I request all of you to please remain seated. We are going to continue with our next session. Given the paucity of time and the constraints that we have, I request all of you to please be settled down in your seats and please clear the aisles. So we're now going to move on to our session 2, and this one is on promoting innovation in healthcare through technology advancements. I request all of you to please be settled in your seats, please settle down. Now, application of new age technologies and innovations can lead to improved patient outcomes, streamline processes, and enhance medical treatments. India is already leveraging technology to overcome geographical and infrastructure challenges, making healthcare services more accessible to a larger population through telemedicine and e-health, creating national health registries and universal health coverage using digital platforms. Please put your hands together and welcome our esteemed speakers for this session on stage. Please welcome Dr. Hema Divakar, Medical Director, Divakar Specialty Hospital, and CEO and Chairman, Asian Research and Training Institute for Skill Transfer, artist on stage. I request all our speakers for this session to please come on stage. Joining her on stage is Mr. Om Prakash Subbarao, Advisor Tech, National Health Authority, Government of India. Our eminent panelists on this session include, and I would like to invite them on stage, and I request all of you to please welcome them with a round of applause. Dr. Sushil Kumar Meher, Head Health IT AIMS. Dr. Sudhir Kalhan, Chairperson, ASSOCHAM National Digital Healthcare Task Force and Chairman, Institute of Minimal Access, Metabolic and Bariatric Surgery, Sir Gangaram Hospital. Mr. Prashant Kulshetra, COO, YOLO Health. Mr. Pravek Saxena, Founder and CEO, Smalt and Beryl. Mr. Amit Bansal, Founder and CEO, Medigens, and Mr. Raj Prakash Vyas, President Corporate Affairs, Cadila Pharmaceuticals Limited. I request all of you to please be seated. Please take your seats. I would request Mr. Sandeep Chen, Director ASSOCHAM and Head CSR, to please welcome Mr. Om Prakash Subbarao, Advisor Tech, National Health Authority, Government of India. Thank you so much, sir, for coming here and sparing your time to share your knowledge with the audience here. We are very grateful to you for coming here. I would now like to hand it over to Hema ma'am to steer this discussion forward.
Thank you, Anisha. Namaskar, everyone, and welcome to the panel without tea break. So keep your mind stimulated. You have the food for thought and the lunch following that. The panel title is Promoting Innovation in Healthcare Through Technological Advancements. Well, for a long, long time, we have been telling ourselves that healthcare sector on one hand and the technology, the advanced technology, including AI, etc., on the other hand, have been dating each other for quite a while, and now it's time for them to get married and move ahead with from innovation, as Akashji said, to implementation to make an impact which would be sustainable. So right from the grassroots of primary healthcare, where we dream of reaching the technologically enabled healthcare, to the moon. Bharat at 100, hum kuch bhi kar sakte hain. With that kind of a positive note, I once again welcome all of you and my esteemed panelists. This is the context on which the people on the ground who are striving to implement and make an impact are the set of brilliant panelists that we have here on the show today. And before we begin the formal panel, which I'm sure will give you many, many insights, and your own mind will work how best you can connect and collaborate with these leaders, and how you yourself can put a step ahead in making this country a better place in terms of technological innovations combined with the healthcare. So may I first request, at the backdrop of this context, a very special address by a very special person amidst us, Mr. Om Prakash Subbarao, who is the technical advisor of the National Health Authority, Government of India. Your special address. Yeah, please, sir.
Hello, everyone. I'm audible, right? I'm audible, right? I think I should say good afternoon because it's past 12. Let me begin by asking you a simple question. Since this particular theme, at least what I'm going to talk about, is basically Ayushman Bharat digital mission, leveraging technology for healthcare. Let me start by asking you all a question. Supposing, see, everyone knows digital, right? And all of us use smartphones, etc. Let's look at the demographics. I think I have 5 minutes, right? Okay. See, now let's take an age. I want to know, in your opinion, who would be the earliest and largest adopters of digital healthcare amongst the medical fraternity, let's say the private sector doctors. I'll give you 3 age groups, and I want you to tell me which of those will be the largest adopters. Somebody aged, let's say, between 35 and 45. How many of you, can you please raise your hands if you think they will be the largest adopters of digital technology for healthcare? Oh, okay. I think a fairly large group of people. I'm going to go upwards. So I said 35 to 45. So 45 to 55, how many do you think will be large adopters and early adopters of digital technology? I see just a couple of, okay, just a few hands. 55 plus, how many of you think will be, okay. I'm glad that at least a few people know what the reality is. Because intuitively, most of you raised your hands when I said 35 to 45. And fewer people raised your hands when I said 45 to 55, and even fewer 55 plus. From ABDM, that's Ayushman Bharat Digital Mission, we are having a program called the 100 Pilots. We are running 100 microsites across the country. And we started by doing 2 pilots, one in Mumbai and another in Ahmedabad. And to our surprise, in Ahmedabad, the largest adopter of digital technology and the quickest was a doctor who was a little more than 55. This runs completely, against our intuitive feeling. So we went and probed further and said, how come? Because our normal thinking says that, it's the born digital people, 25 to 35, who will be early adopters. But that's not the case, because this person told us that, look, the writing is on the wall. And digital is going to happen, and we have to use technology for healthcare. And if I don't adopt it today, I'm going to be the loser, because at least if I adopt it now, I have a lot of hand-holding. All of you are going to come and help me adopt this technology and be successful. If I miss the bus, Tomorrow it will be all over the place and I will have lost it because there is no one I can lean on to, no one who will teach me and enable me. So that's what he told us, and that's why he said he's an early adopter of digital. I will quickly go through what is the Ayushman Bharat Digital Mission, which is the largest healthcare program being run by the government of India. And I would go on to say that it is probably the largest healthcare program of its kind anywhere in the world. Because recently I was listening to somebody from the healthcare department in the US, and whatever we have already implemented, they were talking about trying to do many of those things. If any of you are interested, I can provide you that link later on. So the vision of the National Digital Health Mission is to ensure that there is universal health coverage through provision of wide range of data, information, and infrastructure services, basically using technology. And while all of this is happening, and there is also this privacy laws which are there in the parliament, and everybody is talking about that. So the approach that we are following in ABDM is that everything is going to be federated, in the sense that data is not really going to be centralized anywhere. It is going to be sitting wherever it is currently sitting, and we are just going to leverage that. So that's the federated data architecture. And there'll be a single source of truth, privacy and security by design. And we want all this to be voluntary, and there is going to be no force or no mandate. See, this entire thing that we are talking about as Ayushman Bharat Digital Mission, we think should benefit everybody. It should benefit all the stakeholders, and if you say the citizens, it should benefit them. It should benefit the healthcare providers, and it should also benefit the policy makers. How will it help citizens? Better control over your medical records, no loss of records leading to repetitive diagnostics, because oftentimes the complaint that we hear is that the same tests are repeated when you go to a different doctor or a different healthcare facility. And then for the healthcare provider, it's better clinical decision making and easy adoption of teleconsultation and so on. And for policymakers, if you integrate all of this data, which is really available in a federated model, as I said, it's not going to be centralized anywhere. It will help fine-tune and implement the policies. So the longitudinal health record is what we are talking about here. Let me skip all of this. So for those of you who are technologically inclined, this is a slide where I wanted to say that the technology stack is really built on 4 layers. First is the digital public goods. Again, India is a forerunner everywhere, and even for the G20, the digital public health goods, India is a leading force. On top of it, we are building all the services. That could be telemedicines, health records, health claims, and so on. Then on top of that, you have the universal health interface, the consent manager, because basically the individuals own all the health records. And it is only by consent that it can be made available to anybody else because of the privacy which is of paramount importance in this whole scheme of things. Then, of course, there is this health claims exchange, which is also part of this. And on top of this, you will have several applications, both the provider, payer, the health management information systems, and so on. I'm just going quickly because we can cover the details as part of the panel discussion. And one of the core these are the core building blocks of ABDM. We have an Aadhaar number, which is a 14-digit unique identifier. Then we have registries which we are building, which is the Healthcare Professionals Registry, the Drug Registry, and the Health Facility Registry. So these are all things which are building blocks of ABDM. And we are following certain key design principles, which is basically inclusivity. It should be consent-driven. Everything, nothing can happen without the consent of the individual. So these are some of the design principles that we are following. And yeah, so the key thing here is interoperability. I will just stop at this slide and say one of the key features of ABDM is that is interoperability. This concept is simply this, that if I am sending an email, I am using Yahoo Mail, and let's say you are using Gmail. As long as I know your address, I can still communicate with you. Even from Yahoo Mail, I can communicate with you, and it is seamless because of a common protocol, which is called SMTP. So the concept is, why can't the same thing apply to a healthcare system? If there is one health facility where you go and get all your tests done, the same records can, as long as it is ABDM enabled and you're following the same protocol, it's a very simple thing to build. Like, in finance, everyone is familiar with UPI. You can do peer-to-peer money transfer. Same concept. We have a UHI, Universal Health Interface, when all the records, all the data, all the information can be seamlessly transferred between one health facility to another. So this is one of the fundamental things which we have in ABDM. I'll just stop here, and then we can carry on with the panel discussion, and we can get into the details. Thank you.
Thank you, Om Prakash Subbarao ji. The mega vision and mission of the government is indeed laudable, because the questions that you threw and the perception of people that it may not be the 55 plus who would actually adapt to this. I guess it is some of us as mature leaders in practice realize sooner rather than later that if we have to reach the last mile, leaving no one behind, digital technology is the only answer, and India has proved itself leapfrogging on many issues, and this may be one of those. So perceptions could be different than the reality. And now coming to the ground realities. Let's start bottom up. So I was telling Sudhir Kalanji, your questions will come right towards the end, because we want to start from the grassroots. So my first question will be to Mr. Kulakshetra, Prashant Kulakshetra. They have the concept from YOLO Healthcare, just like an ATM machine, one healthcare kiosk, which you can operate and get many, many tests done. Again, inspired by the question asking from Om Prakash ji, let me ask you, if we want to give one YOLO ATM health machine to every village, any guesswork on how many villages are actually there in India? Maybe many of you know it. Is it several thousands, or 4-5 lakhs, or 15-20 lakhs, or over 60 lakhs, or what is the kind of guess? Every village we want one. So which is the bracket? 6 lakhs. 5 lakhs. 6, 5. Okay. Now, Prashant Kulakshetra ji will answer this question on the dream of YOLO in every village. We have over 60 lakh villages.
Correct.
So what is your vision and thought process, and what does YOLO actually help us do?
Right. Thank you so much for giving this opportunity to talk on this subject, which is more to do with health. So YOLO Health, YOLO, when we were framing the name, we thought of many, many names and words, and then we came down to conclude on YOLO, which means you only live once. So we all live once, and if we were to perform and if we were to live happily and contribute, obviously health is the first thing that you should be able to get in perfect shape, or try to be as perfect as possible. Not only physical, mental, social and spiritual health also. In a country like India, where we have so much of diversifications and things which change quite a lot, even in a frame of 10 kilometers, and where we have about 60 lakh villages and areas which are really geographically inaccessible at times, and we may talk of digital health solutions, but then there are areas in India, even on practical grounds, when we were implementing various projects in states of Arunachal, Mizoram, Sikkim, and other places, we found that internet was also an issue. So we are not having a very robust digital infrastructure also to support such innovations. But when we were making this ATM, or we took this ATM frame from automated teller machines, which are used for drawing money. So we thought that this should be automated tele-Medicare, which should be there. So anytime Medicare kind of a thing that we were envisaging for ourselves. As in the beginning of the inaugural sessions, we heard that real-time problem in India is not only adopting to innovations, technology or infrastructure, but the issue is that how easy it is to get the manpower or trained manpower to perform such things. So we went into excising a lot and then adopted to technology, which was more so commonly used by any person here in the hall or maybe outside. You know, if you are competent of running your Android phone, you can probably run the ATM. So we devised a very simpler operating system. We adopted to a very base level of operation UI so that it is easy for anyone to operate and conduct. And we integrated various medical IoT devices of clinical grade into one single health report interface, which gives you roughly around 94 parameters for your health screening, which we do. Happy to be part of this initiative. When we started, it was difficult to begin. Then adoption happened, as rightly said, COVID, when we experienced that technology can do a lot of changes. We today have more than 1,200 installations in very remote areas of India in different states, at least 7, 8 states where we have this. We work with government, we work with CSR bodies and corporates. So we are still considering ourselves to even evolve further. Currently, we have capacity to do about 80% of NCDs that we can address. We are looking for innovations in field of cancer, especially if we can do something with IoTs or quicker diagnostic in cancers. That will make us complete this thing for at least serving the 56% load on NCDs completely. So we are building, as rightly pointed, government, which is the biggest pathbreak mission, you know, ABDM, and we are excited because 2017, when this document came on National Health Authority and digital missions and the kind of framework that was developed, we are also adopting the similar health tech and technology which has been dictated by ABDM. So just to make you understand in a simpler context, every one of us has experienced UPI, which is the payment interface. Like, so NPCI, or the National Payment Council, Committee, what it did, they gave you a single UPI ID, and with your payer and the bank, this ID was linked for doing all your transactions. So now what ABDM, in simpler terms, what they are saying is, we will create a unified health interface where each one of us, whether a citizen or consumer or a healthcare provider or a facility or anyone, will have a unique ID on which there will be various interactions and transactions which will happen. So as he showed in the last slide, the top layer is the user applications, where it is like, you know, search and book kind of functions, applications which will be there. So you can search and book something. The second is the decentralized health protocols, or the UHI interface, which will link to the services applications and the extended applications, which can tomorrow, maybe, when UHI, which is in fact, in my opinion, this is going to revolutionize, and in next 5 to 10 years, our healthcare will be the example for various developed countries to see it, that how this is going to transform. As UPI has changed the entire financial technology thing, UHI will change it.
Thank you, Mr. Kulakshetra. I think you have had a long journey of 10 years into this and 1,200 installation. YOLO, you only live once, we remember that. And in fact, the Femtech revolution is happening in the country, being in the women's healthcare space. I can speak for girls and women for whom we have created the technology enabler in rural Karnataka, where the girls and women are having a rapport with the Swasthya Sakhis, where the capacities of the human interface with the technology is built there for the trust factor to be an enabler for them to utilize the services of the point of care devices as well as teleconsult with the access and confidentiality for girls and women, which is a very, very special factor in this great country. So thank you very much. I would request all the other panelists to be really on the fast track because, the tea was served here somehow because we were late, but the lunch cannot be skipped for sure. So we go to next. So we just imagine that today we've landed on the moon, so we can also keep one such technology-enabled health records, which will be cut, paste, and put onto the ABDM. So we have the whole country with the Aadhaar card, with their health records, etc. That will be a dream come true at Bharat 100 for sure. Not only serving the diverse population in our country, my question to Amit is, dealing with the medical tourism. Everybody knows the skills and the cost effectiveness, the advances which our country has made, and they want to come into the country for their health care. But there may be many intervening factors which probably have not allowed us to scale as much as we could. So could technology be an enabler for the medical tourism space, inclusive of the fact that all reports sent in advance, 1 or 2 teleconsults with the doctor whom he is going to see ahead of their arrival into the country, right from the airport, a seamless connect with the technology of how they will reach the setup, and they know whatever else happens there is driven through a abstract, unknown technological form, which makes their whole experience very positive, very rich, and wanting to come back again for more wellness rather than illness in the country. Amitji.
Thank you, Dr. Hema, and thank you all of you. Medical tourism, as we know, it's a multi-billion-dollar industry. It is about 25 billion, and India is doing about $3 billion. It is expected to hit $6 billion in a year or so. I've been in medical travel for about 7 years. I run a technology company. I see medical tourism as a massive opportunity, but somehow I strongly believe that we are missing on the most important aspect. I see medical tourism as just a tip of the iceberg. So for me, just imagine when somebody is diagnosed with some life-threatening disease in a country. For us, it's easy that, okay, come over, undergo surgery here. But for him, he has never been. He might not have been to India before. And coming to any country for treatment is not easy, trust me, it's not. So the first and the foremost important thing is actually to empower him with all the right information so that he is very firm about where is he going, who is the healthcare provider, who is the doctor. So he must believe in your country, he must believe in the provider skills and the facility. The next comes is the patient concise services, which starts from the airport transfers and providing all the on-ground support and assistance to make sure that he's happy, not with just the treatment, but also with the administrative staff and the operational, efficiency while he's in the country. And the first and the third and the foremost important thing is actually once he's done with the treatment, he's ready to go back to his country. So for me, I always believe I'm not from a healthcare background, I'm a tech guy. I always believe that the outcome of the treatment is not solely dependent on how good was the surgery. It equally depends on how good is your recovery. So the recovery, has several aspects. It's about rehab. If somebody has undergone orthopedic procedure, if somebody has undergone neurological conditions or neurological procedures, how far you're helping him to get back to the community as soon as possible, And the other aspect is is to provide the holistic approach, for a better recovery. So these all are the elements which contributes to a better experience. It's not just about calling somebody to India for a treatment. It's about covering the pre-treatment, treatment, and the post-treatment step, and helping him and providing all the support even when he's back to his country.
Absolutely, very well said. The continuum of care very seamlessly to make it a positive experience so that, again, he'll feel so well and wanting to be coming back for more into the country. The grassroots and the welcoming, skilled, technologically enabled attitude of getting the patients from overseas. The problem in our own country, what we're facing is about the language-specific instructions. Even in the capacity building, when we train the frontline healthcare providers and the paramedics, there'll be one Tamil batch, one Kannada batch, one Assamese batch, because they can't understand either English or Hindi as a common language. So that has been our greatest challenge rather than the internet connections. So I go now to Pravik Saxena, who is the founder and CEO of Smart and Beryl, and I know they're into the development of apps and the voice, which voice-enabled connect. So tell us more about what is your vision for making things happen to reach everyone and connect to their head and heart in their own language.
Thank you so much, and a warm good afternoon to everyone. I think let me touch upon a very interesting aspect. As ma'am mentioned, technology and healthcare are two very big and very impactful industries. And when we talk about getting them married together, I think if you talk about technology in healthcare, it touches 4 different categories. Number 1, and if you see in your agenda, we talk about infrastructure. How technology can change infrastructure, and talking about new devices coming into the picture, new type of scanning machines, etc. The other thing that we talk about, the category 2, is diagnosis. How we are improving and using a lot of AI to detect post-COVID pneumonia, to probably how do we cure cancer. The third category is medical education. How we are using a lot of augmented reality to create those immersive experiences for medical professionals to better understand the concept. I met one of the gentlemen at a hospital, and he said, if you can explain what a keratocyst is to the security guard who stopped you for your pass, that is when you know the concept. It is said, अगर आप संक्षेप में किसी को बता सकते हैं, वही इंसान बता सकता है जिसने विस्तार से पढ़ा होता है, and विस्तार means in depth. So this is the third application or categorization of technology. We are missing a very, if ABDM has to leave an impact, I was in 2008 in London, we created for NHSBT an organ donation and transplantation system. The same technology stack was used in 2008. The same unique health ID is there. And countries who are spending double digits percentage of their GDP will not get impressed by this. Now, all of us who have walked up, I'll take a couple of minutes to come to my point, ma'am. All of us who walked into this hotel, we have been to a number of hotels. Does this facade fascinate me? Does this lobby fascinate me? No. It is the people who fascinate me. Where in the agenda have we mentioned the word people? If you want to use technology, create compassionate experiences for people. I know a company, I think Dr. Kallan sir is also a part of that, My Follow-Up. This is one company which is using technology to create compassionate experiences. We have had enough players in the market to improve infrastructure, to improve diagnosis, to improve medical sciences. Let's now talk about giving those personalized, or I would say hyper-personalized experiences to individuals. That is what will bring the change. And I'll pause my sentiment right now, ma'am. I'll be happy to elaborate on this later on.
I think really, Pravik, that was a point very well brought out, because many people who didn't adapt to the technologies were telling there's no touch and feel, and there's no human interface, so this will not work. But through the technology also, who is the communicator who is giving enough time in the tone which is appealing in a compassionate manner, who is explaining the advocacy part of it, the reassurance, the confidence building, the motivation, and the positive spirit in the patient. All of these can definitely be done, and also especially by the voice technology. It's like somebody, with augmentation reality, it may be just that person is sitting right next to you and speaking to you. So these are possible through technology, and the future is here and now.
Ma'am, may I just take 30 more seconds
please.
with your permission? I think today the challenge is not whether I use technology to make something accessible. There are enough solutions for it. Tell me a scenario. If somebody in your family, God forbid, goes for a scan and they are diagnosed with a stage 2 cancer, how do you operate? Do you open a practo? You don't open a practo. We look for people like these who are sitting here. I wish there are some contacts in my phone. And I would call, say, Dr. Kalhan, sir, this is what is there. Can you please help me get the right understanding? Now, imagine Dr. Kalhan taking this up personally, streamlining my appointment. I go and meet a doctor. I get the right, appropriate, personalized opinion as applicable to me. Do people understand my context? They don't. Then everything is streamlined, right from my medical records to probably getting a care at home. If I am able to create such experiences, this is what will be a game changer.
And I'm sure that these thoughts and ideas to be translated into action with the innovative and jugaad methodologies that we have in our countries will be definitely sooner rather than later. We are very, very hopeful of that for sure. So communication was brought out in a compassionate manner. It's a very, very key ingredient. But for us, technically as doctors, communication is also communicable diseases. So we swing back to the next panelist, Mr. Raj Prakash Vyas, who is the President of Corporate Affairs, Cadila Pharmaceuticals. How can you use the technology to bring in a situation like Nikshay is a zero tolerance for tuberculosis in India. So similar, concepts about many communicable diseases which can be wiped out and washed away from the country. How can technology enable that?
Thank you, Dr. Hema. Research and innovation is the backbone of the pharmaceutical industry. A pharmaceutical industry cannot survive without innovation and research. Apart from the huge investment in the research, there are 4 P's which fulfill the research process. One is the purpose. What is the purpose of the research? The research is made for. Second is the perseverance of the process to be followed. Third is the passion, because without passion, research cannot be completed and to achieve the desired objectives. And fourth important P is the passions. The scientist, the research and innovator have to be patient for the outcomes. To eradicate and to minimize to prevent the communicable diseases, there is a need to create the awareness of the ignorance. Our rural populations mostly perceived communicable diseases as an act of God. So there is a need, and it's essential to create the awareness about the disease. Second is to create the infrastructure to deal with the crisis. Sometime we have seen during the COVID time that crisis may be further aggravate and it may be converted into a disaster. So timely taking the steps is essential to minimize the spread. Third important is the immunization as much as possible. And needless to mention the importance of the isolation. So the ultimate objective to prevent and make a complete cycle, there is a need to prevent, diagnose, alleviate, and cure. Cadila Pharmaceuticals recently came with the innovation of world first 3-dose rabies vaccine. Earlier, the practice was the 5 doses, which were very complex because the 5 doses were spread 0 days, 7 days, 14 days, 21 days, and 28 days. Any missed dose can attract 100% fatality rate. So Cadila Pharmaceuticals make the huge investment and come out with the 3-dose rabies vaccine, because the main challenge in 5 dose that the patient has to be engaged throughout the month, and it's for the persons who is remotely living. As Dr. Rana rightly said, that affordability and accessibility is the major challenges in healthcare ecosystem. So Cadila Pharmaceutical came that 0 days, 3 days, and 7 days. It's only a 1 week. It's only a 1 week. So it's the world first 3-dose rabies vaccine. So it is very important to identify the research areas and to deliver with the objective of affordability and accessibility is the ultimate objective and aim for research and innovations. Thank you.
Thank you, Raj Prakash Vyasji, because when we say the 3 A's, the affordability, the accessibility, and awareness, you brought in a very important point about if they're not aware, even if they can afford it, they may not really avail of the services. So thank you very much for your inputs. Before I move on to the last 2 panelists, it's my duty to thank them for their patience, because I told that I will approach from bottoms up, and AIIMS being the largest institution and our pride in the country, and SHM, which we are equally proud of as an organization. So the leadership from both these are to be questioned now before we throw it up for a 5 minutes audience interaction. So Sushil Kumar Meher, who is the head of Health IT at AIIMS. We know of the fact that it was, in the Delhi AIIMS that Tata's probably put up their first of the technology-enabled decluttering and how to navigate the patients in such a rushed thousands of the outpatients coming into your center. So as the head of the IT, we want you to address the opportunities as well as challenges that you've had within AIIMS as the position holds for battling with many things, though ultimately we know that the ease with which many things can be done with technology also has some limitations. So.
Hello. Yeah, thank you, Dr. Hema, and thank you to the organizer, the SHOCAM, to inviting me such a wonderful events. I'm really honored of this invitations. Anyway, AIIMS, everybody knows it. And what is AIIMS? Many people, they understand it is a hospital. It is not a hospital, first of all, you have to understand. It is an institute for the higher education research in the healthcare. And for this, we need the healthcare facility on place. Anybody who faces any critical disease, they look towards AIIMS New Delhi, how to reach there, how to get the treatment, and come back. For this, since 1988, AIIMS has started digitization of their whole healthcare systems. When we do the research, we need the data. Without data, we can't do any research. For this, we need some system in place to capture all clinical data in one place. Second part is that what Dr. Hema has spoken, we are heavily loaded for the patient also. Always many TV channels, many leaders, they are saying, AIIMS hospitals, they do this. But it is a hospital because of you need it for our research. And we entertain very critical patient, which is non-treatable, they comes to AIIMS, get for treatments. Even major super specialty hospitals who are giving super specialties treatments, they also at the end, they hands up their hands and go to the AIIMS for the treatments. So these kind of things we do it. It means that we largely dependent on the large patient populations. We get around 14,000 patients a day in our OPD. And around 800 plus patients, they get admitted every day. So this is the scale we have. What is the demand? Our demand is around 45,000, but we are performing only 14,000. When demand and supply has a gap, then definitely we'll face the problems. There will be chaos and all these things, how to handle it. And we have started bringing the technology to make that efficiently how we can do it. And what we have done it. First, with the how we can give a good patient experience. Okay, when patient is in very critical stage, come to the AIIMS, standing hours of time, get the queues and get the registrations after meeting the doctors. Again, it has a lot of appointments to get the investigations. It is a big challenge for the patients. First step, what we have done it. When you will come to the AIIMS, take appointments. The appointment is online available. It's the first institutions who has bring up, the public institution who has bring up online appointments through phone, through call centers, through apps, through websites, so that people, they can come from the different locations of the country and get the appointments, and they come to the hospital on that day, on that time for the treatment. Second part is done. It is the only hospitals, only institutions in the country they have done it. When will it come up? Registration is totally a counterless. Come here in the OPD hall, there is a QR code is pasted in different locations. Scan it. After scanning this one, it will ask that you have the Aadhaar ID, Ayushman Bharat Health ID. If you do not have, then it will ask the your Aadhaar number, and it will create automatically your health records in Aadhaar ID as well as the registration process from your phone. It is not required to go to the counter. And from there, you have to move to the room number which is allocated to get that treatment. This is the one process we have reduced. Though people are waiting for at least 3 to 4 hours, it has reduced to hardly 3 to 4 minutes. This is the one of the things we have created it. Second part is that we have the only instrument in the country, we have a robotic labs. Only the manual intervention is that only the sample has to be collected and the investigation has to be ordered. Investigation has been ordered, and the time you'll go there, collect you donate your samples. After that, every process is automatic till the reportings. And we have the robotic labs. Each and every sample will be handled by the robotic hands. And per hour, we are performing around more than 3,000 tests in that lab. And similar kind of labs, we have 2 labs in the premises. So that, and the reporting time is only 2 hours. So many places, same day, when you are come to the OPD, you'll get the reports, and you can show the doctor and go back. This is the whole thing. So, if time permit, I can go for, or you can go for any other.
No, I think you have beautifully exposed the scale of expansion that's required, because this says innovation and sustainable solutions. So anything which is not scalable in our country is likely not to be, making an impact, because again, as Amitji said, it's tip of iceberg. Everything that we're doing in couple of hundreds, couple of thousands, when the Western world looks at us, they, oh, it's great, you have reached a number of 1,000, but then they do not know that we have to reach 100,000 at the minimum to have an impact. So that is how it is. So if you exclude the special guest, Mr. Om Prakash Subbarao, there are 7 of us in the panel. In Hindi, 7 is Sat. So Sat, we want to ask Sudhir Khalanji, who is the chairperson of SHM National Digital Healthcare Task Force. what is it that you want to do with all of us and more? What tasks we have to perform to make this innovative, sustainable, scalable initiatives without compromising the quality to drive it forward? What is your vision and mission, sir? And how do we make it happen?
Dr. Hema, thank you for giving me this opportunity. Let me say that, I have been associated with SOCHAM for the last about 5 years, 4 years as the Healthcare Council, and now specially I have been told to go with the Digital Healthcare Task Force. So, if you ask me, I am glad today that the fruits of technology are finally reaching the healthcare sector. The technology was developed in entertainment, everywhere. 10 years back, you could get a pizza in 30 minutes, and I'm saying that today, even after 10 years, I cannot assure you whether an ambulance can reach your house in 30 minutes. So the technology has not gone into the healthcare center. If you see, let's first of all, since it's my concluding talk holistic about the healthcare sector. See, what are the difficulties, what are the weaknesses that we have of the healthcare facilities in our country? Firstly, the diversity, the inequality of the availability of resources, and you have a wide gap between rural and urban India, between an A-class city, a B-class city, or a C-class city. So that is a very big gap which only I think technology can bridge that gap. But what is the strength that we have? The strength is that we are a young country, we are a country which is fast adaptable, we are very resilient, and we understand technology. When the Prime Minister talked 4 years back about using a UPI and a QR code, many people in the opposition, they made fun of him, that how is it going to happen in the village? And today you go around, even small vendors, pawn shop, everybody's getting a QR code. Outside my hospital, there are 10 people who are selling probably amrood or challi or whatever, and they have a QR code there. So that is how resilient and how adaptive we are. So I think we will have to use technology to create a healthcare network and, get that goal of universal healthcare for all. And I think there is where public-private partnership has to be taking place. ABDM, government has come up with a beautiful thing, getting an Aadhaar card. And I think unless in the private sector we work hand in glove with the government, it will not be possible to achieve that task. I'll just conclude by, about 5 years back when I first attended my healthcare council meeting, everybody from various industries were talking. Everybody is talking about a 5 trillion economy and 8 to 10% economic growth. Not one person talked about health. And as usual, healthcare was the last council to represent. And when I stood up, I said, sir, with due respect, all of you are talking about a 5 trillion economy and at 8 to 10% economic growth. But what if my young children are not healthy? What if they have diabetes, hypertension? Please let us talk about health also on the same platform. So I think it's very important that if you want to grow and make a strong country, we have to focus on education and quality health. I'll conclude with that.
Very well said, Dr. Sudhir Khalan, because after the COVID, at least everybody has recognized that health is wealth. And act today for a better tomorrow is our mantra, because unless we get a handle on many things with the optimal use of the kind of skills and the expertise and the brains that the country has, we will be giving a gift of healthy generation to the ongoing couple of years when this stabilizes. It will be Bharat at 100 doing many more unimaginable things which will be a role model for the rest of the world. We are quite sure that if we collaborate on platforms like these, bring our thoughts together, brainstorm, and it is a mix of the unlike minds. And there is too much technology and very little health and healthcare personnel in that. So the perceptions of what we actually need and how we co-create that for the best benefit to reach everybody is... Yeah, please, sir.
You see, many years back when SOCHAM was interacting with the health ministry, I'm talking about 5 to 6 years back, we all agreed that the first step was creating a good infrastructure. That means taking the optical fiber right down to the villages and, giving a smartphone to the multi-purpose healthcare workers. And, as if it became like a blessing in disguise that when COVID struck, already that part of that infrastructure is already in place. Many of the healthcare, multipurpose healthcare workers had their smartphones. So we provided them, I mean, the ventilators and the pulse oximeters, and they didn't know how to use it. So just using a smartphone and doing a video call, we showed them, okay, you show us the oxygen saturation, you make the patient walk and let us see how much the oxygen saturation, you know. And let me tell you that if WhatsApp was not there, we would have lost many more lives in COVID. So that was an unorganized sector. Today, you know, we have YOLO, we have so many other things. Pravek doing good work, everybody, but they're all doing in their own respective field. For many years, we have just talked about what is advances happening in healthcare. I think we must all pool in our resources, pick up areas of brilliance from various sectors and all sit together and do something substantial now. The time has come.
Thank you, Sudhir sir. Boliye sir.
I just want to respond to what some people have been saying. You know, my friend Pravik spoke about organ donation in UK and all of that. Let me assure you that ABDM is a program which is very well thought out, and the government of India has factored in all of this. Organ donation is very much part of ABDM program. Absolutely. And trust me on this, you think of anything world-class in the world, it's there in India, and the plumbing is already there. It's for the private sector and everybody else to just leverage this. So that's what I want to say.
So we need to do workshops now. Yeah. Workshops of ABDM, and we have to, you know, I have interacted with many of you and seen ABDM from very close quarter. It's a fantastic program. Only thing is, I think we have to train the trainers, you know, identify people from the sectors and go around and then, you know, tell people what are the apprehensions about accepting ABDM, and that way I think it's going to be.
Rather, I think, sir, digital health task में हम लोगों ने already discuss भी किया था that how we are going to take these opportunities to the industry and academia where they can participate. Use cases, people who can actually do a lot. There are various opportunities with ABDM to be an entrepreneur in yourself. You can actually start several companies based on ABDM alone. So it will give a boost to the health tech startup and others who are in service sector to encash on these possibilities. So that task force, we will spread it out, and that will be more practical to adopt.
So before I allow 2 questions from the audience, we must thank ASSOCHAM for bringing us together on this platform, because the essence of the conversation was we have to break the silos and collaborate with each other to do better than the best. And I think on forums like these are just great beginnings for many more things to happen between all of us here and all of you there. So any 1 or 2 burning questions from the audience, if you can. Yes, the mic is also close by, luckily. And identify yourself and please direct the question to whomsoever. Thank you.
Hello, madam. I am Ravinder Singh. I am technology expert. I represent India at Expo 85. Madam, my mother was being treated in AIIMS. She had urine infection beyond control, beyond standard limit. So, but the question is, but the AIIMS, entire geriatric ward treated her for dementia, and she used to take, when she has pain in her kidneys and things like that. They were having ultrasounds, and they were taking brain scans many times. 10 times ultrasounds, and they eventually killed her. And this is so tragic, when in the doctor
Actually, sir, please, I request you please ask a specific question, sir, please. We have a limited time, sir, please.
The question
specific
is,
question, please.
Question is, when the path lab, found that the infection in my mother's body was beyond, you can say, maximum limit, she should have been immediately directed to some urology department.
Okay, thank you,
so,
sir. We
sir,
do recognize
automatically sent to some urology department, but what actually happened was, AIIMS, killed her.
No.
Thank you.
No, thank you, sir. This question brings to our minds that there are very many limitations still, because preventive care and seeking early treatment is also a part of this whole continuum, and specific instances like this bring forth the possibilities of doing better through reaching every family, every home, to make them aware of when they should seek help, where they should seek help, and the necessary things that should go moving ahead with that. Sir, your question. Mike Netiji, please. Two more, okay.
Yes.
With these three, we will close the session. Sir?
Hello and good afternoon.
Yeah.
Yes, my name is Sandeep, and my question is to Prashant actually, and this is regarding the technology interface, which is very helpful actually, but there are a lot of things which needs to be done. And I wanted to ask you a very specific question. Using the Aadhaar card, can a private provider can seamless transform the information available in his or her tablet to the government service and start getting those benefit also? Is it possible?
Right. So answer is very simple. What ABDM proposes is an open API interoperable framework. Right. So government, what they are doing is they are preparing a backbone on which any kind of applications, whether provider, user, payer, or any extended services, allied services around health, they can interact with this. So as you are saying, any possibility that you see in healthcare, whether it is registry to the change in any clinical access to service or data exchange or even payment in future, can be done on this single backbone. So it has immense possibilities.
Yeah. So the building blocks are there, Dr. Bhalla, and it has to just layer over that. And the last two more questions, please. The gentleman in the white shirt here. Yeah. Sorry to be calling out from your shirt color.
Hello, good afternoon. Myself Kapil Parashar. We are from Vyom Foundation. We are working in the Internet of Medical Things and Web of Medical Things since last 10 years. And we have already worked with the Ayushman Melas and Ayushman card holders as a free services in the rural village by trained the Anganwadi workers and our own workers. My question is that according to the rural and the tier 2 cities, there is a huge demand of multi-skilled manpower in IoT devices and the web of medical things with the basic knowledge of medicines also. So we have introduced in the rural areas by providing them only NSDCs providing that certification. But we need the Ayushman Bharat also, because there is a big gap between the Ayushman Bharat service providers and the basic or needy persons in the rural areas. So can we provide some certification to the Anganwadi workers or any who are looking to work with the Ayushman Bharat awareness program?
Yeah, thank you for this very important, relevant question, because I just want to place in front of this august audience that HSSC, that is Health Sector Skill Council, we are already creating certain smart, short digital courses for even community volunteers, Anganwadi workers, ASHA workers, ANMs, GNMs, frontline healthcare providers, because we've recognized that there are 28 million school college dropouts every year in this great country. And NSTC courses are very prolonged, very intense, and it may not be feasible or practical. In a smart way, where they can learn in a shortest period of time. Swasthya Sakhi is for the women's section, like the Arogya Mitras for the COVID. So it is in the making. One very last question, just one more minute Anisha will give us, and then we close. Sir.
Good afternoon, panel. My name is Ujjwal Pratap, and I represent Eco India, which is revolutionizing healthcare capacity building across the country. And as a testament of that, we won 2 awards today, and we are very glad. My question is, how important does the panel think that innovations and partnership is for health system strengthening, and what role does the panel think that capacity building can play in towards achieving that goal?
Yeah, many mics are going up, so yes.
See, for the healthcare capacity building, yes, play a major role here. About the technology, what I am talking about it, right now technology is moving towards the precision healthcare. For this, we have making the many capacity building courses, that is biomedical informatics. Okay, biomedical informatics, we have started last 22 years training program for the government employees or government doctors. We are training them that what is the medical informatics in place so that they can promote everything in their organizations. But in future planning is that biomedical informatics, it is coming up because it's an interdisciplinary subject. So many, you can say, heard about the news that medical hospitals are coming up in IITs. Why? Because it is interdisciplinary systems, it has to be placed, then things will come up. About the IoT device I'm talking about it. One good example I'm giving to you. When we have started IoT for the medical devices, we did not find any vendors. AIMS, we have developed our own. We have purchased some open source hardware. And that is around 2,000 rupees, and we have started interfacing the medical devices to the HIS. And that is because the technology was not available, and the startup people are not ready to take this one. Because many places I have given that, come on, it is a very good business for you. Most of the organizations, the medical devices are there. They are putting the legacy systems, one servers, then connect it, get the data, then transfer it. It is challenging it.
Sure. We agree that AIMS has been the pioneer and role model for many of the things, but we need to work together to scale it up, to reach the last mile in this entire country. And thanks to Eco India, that all of our capacity building programs for women's healthcare also have scaled up 10x times because of the ease of using the Eco India platform, and we really, really do appreciate this cross collaboration to make this world a better place. With that, all of the panelists are requested to just step ahead for the group photograph, and we thank each and every one of them on behalf of SHM and on my personal behalf very, very much. Thank you to the audience for being so participatory. Thank you.
All right, we had one award winner who was running a little late. So I would request Mr. Om Prakash Subbarao and Dr. Sudhir Kalan to please present this award. And this is the award in the category of the Distinguished Doctor of the Year in Cardiology. The first runner-up award goes to Dr. R.N. Kalra. So I would request Dr. Kalan and Mr. Om Prakash Subbarao to please present this award to Dr. Kalra. Congratulations to Dr. Kalra. A round of applause, please. We are very grateful to all our speakers, distinguished speakers on stage for taking the time out and coming here and sharing the wealth of the knowledge with everyone. I would request Mr. Sandeep Jain, Director, ASSOCHAM, to please present all our speakers with mementos. A memento for Dr. Hema Divakar, Medical Director, Divakar Specialty Hospital, and CEO and Chairman, Asian Research and Training Institute for Skill Transfer Artist. Memento for Mr. Om Prakash Subbarao, Advisor Tech, National Health Authority, Government of India. A memento for Dr. Sudhir Kalan, Chairperson, ASSOCHAM National Digital Healthcare Task Force and Chairman, Institute of Minimal Access, Metabolic and Bariatric Surgery, Sir Gangaram Hospital. Memento for Dr. Sushil Kumar Meher, Health IT, AIMS. A memento for Mr. Prashant Kulchetra, COO, YOLO Health. A memento for Mr. Pravek Saxena, Founder and CEO, Small and Beryl. A memento for Mr. Amit Bansal, Founder and CEO, Medigens. And a memento for Mr. Raj Prakash Vyas from Cadila Pharmaceuticals. Thank you all for coming here and sharing your knowledge with everyone. A big round of applause for all our speakers. Just a reminder to everybody here, please do remain in the hall because there are these pearls of wisdom that you don't want to lose out. We have many more interesting sessions coming up. Plus, there is a delegate kit that each one of you can take on your way back once the conference is over. So do stay till the end. We are going to move on with our next session, and we are racing against time to make it for lunch in time. So I request all of you to please remain seated and please keep the aisles clear so that our speakers for this session can come up. Now, our next session is on building sustainable healthcare systems. Sustainability is essential for the long-term success and impact of digital healthcare systems. It encompasses factors such as scalability, efficiency, security, regulatory compliance, and user experience, all of which contribute to a more resilient healthcare infrastructure. Health systems can become more sustainable through improved operational efficiency, resource management, integration with renewable energy, and efficient biomedical waste management. Please put your hands together and welcome on stage our esteemed speakers for this session. Please welcome on stage Dr. Karan Thakur, Vice President, Sustainability, ESG and Public Affairs, Apollo Hospital Enterprises Limited. Joining him on stage are our eminent panelists, Mr. Sanjeev Vashishta, MD and CEO, Pathkind Diagnostics, Mr. Manu Malhotra, Director, RSMS Architects and Chairman, ASSOCHAM GEM Green Healthcare Rating, Dr. Purnima Prabhakaran, Senior Research Scientist, Center for Chronic Disease Control and Director, Center for Health Analytics Research and Trends, Trivedi School of Biosciences, Ashoka University, and Mr. Satish Suri, Managing Director, Green Path Energy and Sustainability Services. Thank you all for coming here. We are looking forward to this discussion on sustainable healthcare systems. I'll hand it over to Dr. Karan Thakur to take this conversation ahead.
Hello.
It's working.
Yeah, it's working. Thank you. Thank you so much. Thank you, ASSOCHAM, for having this important subject as one of the headlines for discussion at the second ASSOCHAM Summit and Awards. And why have we gathered here and why are we discussing sustainable health systems? It's because the climate crisis that is upon us is real. We are witnessing it every day. We are seeing its impacts across the world, whether it is Himachal Pradesh or it is in the south of India, or whether it is Greece or Canada or the United States or Europe. We are witnessing the perils of avoiding what has been the responsibility of humanity. And within the healthcare sector, this conversation on climate change, climate action, the need for sustainable and resilient health systems is more important than ever. And why is that? Because to my mind, when a person is now diagnosed with asthma because of poor air quality or is suffering because of poor water quality, these are people we should actually label as climate-induced patients. These are conditions that have been brought about by various factors, and a lot of it is because of our own doing. And not only that, the impact of the health system on the climate crisis is usually underappreciated. For those who do not know, out of the global emissions that happen the world over, the healthcare system contributes to about 5% annually of all emissions that take place. Now, put this to perspective, the shipping sector, all put together, contributes to about 8% of emissions. So we're not that far off, but when we look at the shipping sector, we consider them as big polluters, and when we look at the healthcare sector, not so much so. And I could not have asked for a better panel, colleagues, friends, people that I have interacted with, brilliant minds to discuss the subject of both sustainability, resilience, and creating a health system's impact. And I'll start with Dr. Purnima. Ma'am, I'd like you to just give some color and context to why we should be talking about healthcare sustainability. What is the need for sustainability? And what are the challenges that the climate crisis is presenting for the health of not just countries, but the entire globe?
Good afternoon, everyone. Thank you, Karan, and thank you to the organizers for this opportunity to speak to this very important topic. So I'll start with two very pertinent issues that Karan laid out at the beginning, which is the climate crisis. So it's no surprise that we're talking about building sustainable health systems. We start with the climate crisis. And why should that be the case? It's no news, no new knowledge now that the climate crisis is a health crisis, not just for us in India, but globally. But the problem is that this is very unequally distributed. So while at one end we talk about the climate crisis in different parts of the world, it is an equalizer. It impacts the countries around the world, but it impacts them in a very inequitable way. And if we think back, take a step back and think where this all started, climate change, as we all are getting to know, is because of legacy greenhouse gas emissions coming from different parts of the world. But in terms of the impacts on health, it is countries in the global south, as we call it, countries like India, which rank high on the global climate vulnerability index. And therefore, there's no place for complacence, and we have to take action, both to adapt ourselves and empower our healthcare systems to deal with the increasing burden that's going to come with the climate events. And that could range from air pollution, which is no new knowledge to people living in the Delhi NCR region. Deteriorating air quality is also a very important outcome of the changing climate. But besides that, the increasing floods, we saw that also happening right next door, right here with us in Delhi. But droughts, heat waves, and a whole lot of indirect impacts of the climate crisis. An example that I would like to call out is the impacts on our food systems. India is largely an agrarian country, and 70% of our food production comes from production in-house in India. And the changing climate, the heat waves are impacting our food security. Crops are getting affected, our food production is getting diminished, and for a country like India, it means impacts on an already not so healthy population. And what happens is we are heading towards what we call the syndemic, which is 3 pandemics occurring at the same time. On one end, we still have a lot of undernourished people. On the other hand, because of the diminished food production, we're going to have more people getting into processed foods, eating processed foods. And therefore, the other end of the malnutrition spectrum, obesity, childhood obesity is becoming more common in India. And add to that cocktail, the mix is climate change. So these 3 pandemics of undernutrition, overnutrition, and climate change is another syndemic that we're starting to talk about. So all of these coming together means that India necessarily needs to sit up and take action. And Karan, you were right that, on one side, we have to empower our health workforce because it's still a very abstract thing, climate change. So it's not even in the medical curriculum for us, not even air pollution. So climate change is still a little distant. So one is sensitizing and building awareness of our health workforce that climate change has a wide range of impacts on every organ system in the body. Respiratory illness because of air pollution, cardiovascular diseases, stroke. There's also mental health, which we often forget. Post-traumatic stress disorders, post-floods, droughts. People are struggling for basic necessities, food, water, housing, and therefore post-traumatic stress disorders and climate change as it pertains to mental health disorders is also something we need to do. But on the other side, the other vertical that the health system in India and globally needs to think about is our own emissions, which also Karan mentioned at the outset. It's about 5% of the global greenhouse gas emissions. Comparing to the other sectors, he said shipping, if we actually rank ourselves with countries around the world, the health sector would be 5th in the table in terms of contributing to greenhouse gas emissions. But I also want to say that, it's not the role of the health sector itself. We can't do this alone. How do we reduce our climate footprint? There's a whole range of interventions that we can take while we deliver health services, starting from sustainable buildings, starting from the way we use our resources. We need water, we need energy, we need transport, we need food, we need a whole lot of things while we deliver healthcare. So every one of those domains should become sustainable. And it can only happen if we build that demand as healthcare professionals, as people working within the health sector. But by building demand, indirectly what you're going to do is also stimulate sustainable manufacturing and production of goods, services, pharmaceuticals that we need for healthcare, all of that, the circular economy can be built if only we as healthcare professionals build the demand. So I think I'll stop there and maybe come
Absolutely,
back to
and very important points. The headline out of this panel discussion is that the climate crisis is a health crisis, and number two, the health system itself, benevolent as it may be in wanting to do good for people, communities, and society, is also contributing towards the climate crisis, as it were. I'd like to draw out your thoughts on what the government's role has been on climate change and health. I know you were last year at the COP. You are dealing very closely with the Ministry of Health on this issue, doing your own research and coming out with some excellent papers. But what has been the institutional response, both from the government side and from institutions and ministries?
Thank you, Karan. So you allowed me to continue the story, the storyline. So just to say that if I start globally, I think the turning point was actually the year 2015, when the Paris Agreement was articulated, and at the same time, there was a global call to health sector for leadership in addressing climate change. And I think serendipity has it that in India, we had the Prime Minister's Council for Climate Change, I think in 2008. There were 8 missions within that council, but there wasn't one on health till 2015. So I think 2015 is when the National Health Mission came into being, and thereon there was momentum built to address climate change as well as a health problem. And today, thankfully, we have under the Ministry of Health and Family Welfare a national program for climate change and human health. Most people relate climate change as an environmental issue, and sure enough, our Ministry of Environment, Forestry and Climate Change did have a national program for climate change. But again, they did not address too much what's happening within the health sector. So today, we have this national program for climate change and human health, which is a vertical within the Ministry of Health working with all the states in India to develop their own state action plans for climate change and human health. And for most of us, we know that India is known as countries within a country. Every state has its own climate vulnerability. There are some that are prone to heat waves, droughts, others that are prone to floods. Some may be having a mix. Some are more prone to poor air quality. So what the national program has mandated is they're given a template that's a national framework for climate change and human health. But states are then required to customize it. And implementation on the ground happens in a very, very decentralized manner, where there are actions and interventions taken to address air pollution, for mental health, for nutrition, but definitely a big focus today on building and strengthening our health systems to become not just climate resilient, but also green. And when we say green, many people think it's about planting trees in the hospitals. Yes, it's certainly good for aesthetics and certainly forms a carbon sink because it absorbs carbon dioxide, but also green definitely means becoming environmental friendly. And when we talk to our hospitals at every level of healthcare, thankfully through the national program, we are able to reach the public health system. So states, state hospitals, district hospitals, down to the primary health centers and sub-centers, we have a conversation going, and I think we were thankful to COVID in that sense that we used the online engagement to reach every nook and cranny of this health system to sensitize them about the need to become climate resilient and to take steps to become environmentally friendly. And I think there are certain low-hanging fruits, one of which was transitioning to renewable forms of energy like solar. And many of our public health systems are shifting to that route and actually putting up solar panels, which ensures that we close the gap between energy provision and healthcare delivery. Oftentimes, many rural health centers do not have energy access, and how that can pan out in terms of health outcomes. Baby warmers, labor rooms, if they don't have electricity, they can't function. So our health outcomes have improved because of this.
Right, so a lot of work is being done both at the national level, at state levels. There are action plans, city-specific action plans in terms of heat and air pollution. So a lot of work that's going on in the space. And it's reaching a crescendo, and I think it'll become even bigger movement. But Satish, I'd like to bring you in here. We've spoken about the government's response, institutional mechanisms that are in place. And we are here, the ASSOCHAM forum is primarily representation from private sector enterprises, private organizations, public sector organizations, PSUs, etc. Now, what mechanisms do they have to have a program in place for sustainability? And I'd like to draw your attention specifically to ESG. A lot of companies, organizations are building in what is the environment, social, and governance platforms for themselves. Could you throw some light how that links to sustainability and how important ESG programs is for organizations when they're tackling both the climate crisis and building a sustainable organization?
Thanks, Mr. Karan. And it's a great pleasure to have the discussion with all the panel members. And so, healthcare sector is normally the global footprint. If you see, 5% of greenhouse gas emission carbon footprint is from the healthcare sector, and the energy consumption point of view. So almost 5 to 6% of energy consumption from the healthcare sector, global. And another important parameter is hospital patient safety. Any kind of safety issues related to hospital healthcare sector, the healthcare sector percentage is around 15 to 18%. I mean the issues rising because of the safety violations or issues. So it's a global numbers I'm talking. But if you see from our point of view, so ESG and SDGs, there are two different verticals but interlinked. And in ESG, normally we'll talk about environment, social, and governance. In the context of environment, first and foremost, the fundamental parameter we need to consider is energy point of view. Energy evaluation, energy study, how we are performing and what is our footprint of in terms of energy and what are the KPIs and benchmarks we have to follow as per healthcare sector. That is to be addressed. In that energy sector, if you see completely renewable energy comes under that, green hospital rating system, when you are going for the new projects or existing projects also can be converted into green hospitals rating system from the ESGBC and IGBC and ASSOCHAM certifications we can go for that. That will reduce around 25 to 30% of your energy intensity on the industry. So that is the first fundamental thing. Next, coming to the water. So every healthcare sector is having its minimum consumption because of the running the facility. So water also we need to be very focused on that. For that, due diligence of the water audit and what is the water conservation point of view, what are the activities to be implemented. That is also to be, and how to minimize the water footprint. These two to be addressed. And CGW norms also we need to follow, and ECBC norms are there, and again National Building Code norms are there for all these for the energy and water point of view. And third one is waste. How to minimize the waste, how to eliminate the waste, and what are the best ways to adopt recycling of the waste. Waste comes to, when it comes to healthcare sector, there are two categories, general waste and biomedical waste. Biomedical waste is separate subject which comes under CPCB norms. Of course, general waste also comes under BCB norms, but addressing those issues are to be differently dealt. And never ever should not mix the general waste and biomedical waste. That is the biggest threat for the entire environment. So this is the way we need to talk for the green hospital sector to reduce the intensity of the footprint of our carbon footprint, and which will definitely give the sustainable way of the hospital sector. And when it comes to sector-wise, so sector-wise, healthcare sector, as of now, there is no standards for the to reduce the carbon footprint study and all. But now the team is also working, government is also working on this, set the separate KPIs and performance indicators for the healthcare sector to reduce the intensity on energy footprint and water footprint. So these are the standards we need to adopt. And another important aspect is the safety. So safety is the primary link to the patient safety and facility safety to the entire hospital premises safety. So which is related to environment, social and governance. Safety is completely related to ESG. So there is no question of environment related or safety, social related, governance related. So we need to address the safety issues as earliest. For that, there should be some separate mechanism for the individual hospital-wise, healthcare sector-wise, how to achieve those goals. So identifying the issues, addressing the issues, and performing the results. So this is the way we need to go for the sustainability under ESG category.
Right, right. Thank you for that. So that provides a good overview of what the sector is doing, what they can do, what the government is doing, what organizations can do in terms of building a program around sustainability. Manu, I'd like to bring you in here. You build hospitals for a living. You've been doing this for a very long time. And you would have seen various waves of needs, demands that have emerged as the sector has matured in India. How do you see sustainability, decarbonization now coming into the health sector and into the built environment? Because we know that that's going to be one key focus area for decarbonization of both an organization and the entire sector. How do you see it?
So, you know, I mean, as you started the conversation with the fact that, you know, healthcare is a major contributor in terms of polluting and in terms of, you know, the energy requirement when it comes to building, because these are buildings which run 24/7, 365, highly intense in terms of energy requirement. So, you know, one classic shift if we actually see through, and you have been into running the organizations, you would see that in last, you know, decade and plus, if you see the energy bills for a hospital were in the tune of about 2% plus minus, give or take, of their top line, right? And if we really look at it today, it has dropped down to 1%, and an industry which has got a long gestation period, that 1% really adds to the whole dynamic, right? And what has really happened in last decade plus is that on both active and passive side of designing the building from an architectural standpoint, you know, in terms of passive ways, a lot of softwares have come in wherein like, you know, Safaria and Energy Plus, where we can run an annual simulation of the building and kind of understand that how you want to orient the building. In urban context, you may not have situations where you can orient the building, but you can design your fenestrations in a way that your energy or heat load is minimal. ECBC 2017 has done a great job in terms of, you know, kind of putting in place certain numbers which help us kind of design the building accordingly. And another thing is that for the patient better outcomes, you know, biophilic design is something which is picking up. ECB has tried to inbuild that to some extent, but we as a firm kind of design our facilities wherein most of our, you know, on a floor plate, 70-80% of the rooms get, you know, views to the exteriors, natural light coming in, penetration deep as much as 50 to 60% inside the room. That's what we are, you know, trying to do as far as the passive ways of eliminating the energy requirements are concerned. In terms of active ways, again, you know, the use of you know, high COP chillers, use of glass systems, which is, you know, lesser on the U value. So these are some of the ways, you know, by which we are trying to see that how the energy requirement can go down. I remember, you know, 10, 15 years back when we were designing hospitals, we were taking, you know, the loads at about 7 kilowatts per square feet, you know, but today it has dropped down to about 3.5 kilowatt per square feet. And this is essentially because of things like, you know, use of glass, use of efficient chillers, LED lighting systems, you know, water conservation in terms of, you know, low flow faucets, et cetera, et cetera. So these are some of the things which are happening.
Right, so that gives a good picture of what one can do when designing and creating a new facility. We are now in a sort of maturation phase of Indian healthcare where a lot of infrastructure already exists. So what advice would you have for people who are looking at retrofits in terms of, you know, as part of their decarbonization strategy? Say a hospital is already 10, 15 years old, you know, they ask for your advice. What are some of the things that they can do to get onto this journey?
So, you know, I mean, that would depend on the life cycle, you know, I mean, how old the project is, etc. Right? I mean, a building in general would have 60, 70 years of life cycle, but then there are components in the building, like I was talking about chillers, etc. You can replace the lights from CFLs to LED. Chillers can be replaced if they have outlived their life. Again, the external glazing system can change. We can actually include BMS because a lot of older facilities did not have the building management system. Building management system coupled with the IoT, I think can do a great job there. And sensors, especially in toilets, etc. You go to a hospital, toilet lights are always on in the patient room or elsewhere. So if you can have occupancy sensors which can actually trigger them on and off depending on the occupancy, these kind of things could really help. Corridors, if they can be put on sensor when there is a movement, the lights can on. So these are some of the things that can be done. In terms of on the water front, again, waterless urinals, low flow faucets, etc. Those things can help.
Right. Dr. Poonam, I'd like to bring you in before I get Mr. Vishisht. You were part of this very big study on energy consumption in various hospitals. I think it will be useful for the audience to understand what you did and what were some of the highlights out of that. This was a wide-ranging study done across public and the private health systems and across geographies. So if you could just throw some light on that, because I'm just picking up from what Manu said. I think it's interesting to hear those insights.
Right. So I think across the panel, I think everybody mentioned energy and energy efficiency, because that's one of the lowest hanging fruits I think that we can pick to address when we want to reduce our climate footprint. So I think what we started out to do, because there hasn't been a national level audit of the hospital sector's energy footprint in India. So we actually, under the aegis of the Ministry of Health, but also because of our work with a network of healthcare providers in the private sector, we started an initiative with a technical group that does energy audits in other sectors. They hadn't done one of the health sector. So we took a representative sample of hospitals from the public health facilities as well as the private hospitals across India. We started out with an aspiration of covering 18 states. These were states that had different climate zones. So in India, if you look at the geographical distribution, we have about 5 climate zones. So we picked states which kind of represented these 5 climate zones. Within those states, we picked public hospitals as well as private hospitals at different levels of healthcare. So as all of us know, we have the medical college hospitals, and then in the public health system, we have district, sub-district, community health centers, primary health centers, sub-centers, and then you have the health and wellness centers now. So the representative sampling was done of the public health system, but also in the private hospital sector, we picked multi-speciality as well as single speciality hospitals. So what this did was we did a survey where we went to these hospitals and mapped out their energy consumption pathways, which meant, the HVAC systems, the heating, the ventilation, the air conditioning, the cooling, per the hospital area, and the EPI, as you mentioned as well. So it was a humongous exercise to actually start with. Our questionnaire had like over 100 questions, and oftentimes you were not able to get the answers from one person in the hospital. Sometimes it's the person who's in the engineering department, sometimes it's the administrator, sometimes it's somebody else. But it also mapped a lot of the end-use things, like the heating, lighting, how many lights and how many ACs, what kind of ACs. You mentioned chillers, the direct chillers. We've just completed the study. We're actually launching the report in 2 days, and so I will not let out the findings.
We'll wait for those
It's a very sensitive time as well, but yes, we do have now the national hospital energy footprint for the Indian health sector, but we've also come up, it was a very insightful exercise because we were able to actually understand the problems that are there in changing end-use utilization. So we've come up with a set of recommendations as well. Many of you in the room, including you, Karan, were part of this exercise. So I'm hoping this will become that baseline report which then the government can then take up and advocate for transitioning to.
Absolutely. we
energy
await the final
efficiency.
report and the findings. But the idea to bring it out here was for the sector specialists to understand that this exercise is on, and they should also participate in greater numbers to really understand what the Indian healthcare energy footprint looks like, because that's when the targets will become more realistic and action will become more real on the ground. Mr. Vishwesh, I'd like to bring you in. We spoke about the climate crisis, global action on the climate crisis, what the government of India is doing, what intermediaries like various organizations, research organizations are doing, what organizations can do on ESG, on sustainability. The built environment is going to be very important. But we haven't spoken about two important stakeholders, and that's business leaders like yourself, CEOs, and the staff. It's not going to be possible to build sustainable, resilient health infrastructure without leadership buy-in. Now, India faces, amongst many challenges, a challenge to grow, to become more accessible, whether it is through physical reach or through technology. And at the same time, now the imperative is to grow sustainably. And not just green, but sustainably. How do you square that circle? When you are taking a business decision to expand, and I know PathKind is rapidly expanding, how do you put both hats on at the same time, as it were?
Yeah, very pertinent and a little, I must say that we are shifting gears here from sustainability from the environment point of view to the business sustainability per se. So you're right. I think if you talk about accessibility, and the basic premise when we started PathKind was to reach out to the people in the tier 3, tier 4 cities with superior quality diagnostics. So I can dwell on healthcare from my earlier life when I was running hospitals to now PathKind. Certainly, I think accessibility is a big challenge. And what are the key things which I feel are really restraining us from really being accessible to the masses, especially in the hinterland, places which are really back of the beyond. So one is, shortage of healthcare professionals. And everybody knows that, whichever parameter you really gauge how we are as a country, I think we are really trailing behind. And in some of the parameters behind the sub-Saharan countries also. So talk about the, per bed, 1.4 beds per 1,000 people, 1.7 nurses per 1,000 people. We have got 0.69 doctors per 1,000 people. But that's not just the point. The whole thing is that, we have to continuously be working towards, making these professionals, reach out to the masses in whichever way, either by using technology or even otherwise. Second is the, lack of quality orientation. And that's, again, is a big challenge. In the smaller cities, you'll see smaller towns, villages, hamlets. You'll find, while we have got about 13 lakh doctors in the country, most of the work is being done by the quacks or the people who don't understand science as such. So I think it's about time that quality orientation has to be given and reach out to these people with superior quality diagnostics or healthcare. Third is the insufficient spending. I mean, we know that, we spend just about a little under 5% of the GDP on the healthcare, including diagnostics and everything else. And the government spend is just about 1.4% of the GDP. In comparison to the Western world, obviously we don't need not, it'll be an unfair comparison, but the fact of the matter is, let's talk about US where the GDP is about, say, 22 trillion economy. The spend is almost like 19-20% of the GDP. So ours, we get really dwarfed in terms of, kind of spend we are doing. And there's no blue sky research happening or almost negligible blue sky research happening in the country because of lack of funding, lack of endowments, aids, et cetera, et cetera. So how do we really, create the thing, create an ecosystem where we are able to reach out to the last person in the remotest of the villages? While Ayushman Bharat is a very good step in that direction, yet I think even the private sector, which is today dispensing about 70 to 75% of the healthcare, has to really step up the efforts. And what I feel is that we have to take, probably, time has now come to take a cue from what is happening across the globe in some of the developed countries, where we talk a lot about the integrated healthcare systems. Just to cite one example, example that comes to my mind is Kaiser Permanente. These guys, they have insurance company which are, they insure the people, and too much of emphasis is on keeping the people healthy. So if a person goes to a hospital in a really sick condition, lands into a, let's say, ICU or a CCU, the cost of treatment is very, very high. And especially it's a huge burden on the public hospitals of government exchequer. So why not we do something where, a sizable amount is spent on screening the people, diagnosing the people before time so that they don't really land into a hospital or don't land into a hospital in a very critical condition. So I think one area which I thought Ayushman Bharat can play a big role. Today it's limited to the hospitals, but bring in diagnostic services into play and spend more and more resources on screening the people. So that could be one of the things which we can do to really make the things accessible, across the country, length and breadth of the country.
Right. So useful insights there on how to grow sustainably and also improve access at the same time. And the second part of my question to you was on the staff engagement. They're going to be important force multipliers on this journey of sustainability. In your interactions with your organization's leadership or your HR teams or others, how do you really push and nudge teams towards this new thinking around sustainability, both in terms of financial sustainability, which is important, operational efficiencies, but also now environmental efficiency, sustainability?
Yeah, so see, fortunately or unfortunately, what I've seen is that when it comes to environment, it always takes a back seat. I think we are on the brink, if I may say so. I don't want to be sounding apocalyptical, but the point is that we are quite there. And people have to be sensitized. And obviously, all these things start from the top. Ideas to, in our case, if I talk about diagnostics, for instance, where today we have got 100 labs and 3,000 odd collection centers across the length and breadth of the country. One small step that we have taken is, to ferry the samples, we're using these two-wheelers, which are electric vehicles, those EVs. Secondly, one small step again talking about, how do you dispose of the biomedical waste? So at our level, lab level or collection center level, we can manage that. But what happens behind the scene, the contractor to whom you have given the contract, is he discerning enough or is she discerning enough to really ensure that the biomedical waste is disposed of in a way it should be? So that's one thing. Second is it's all about training the people. There's a huge gap between the qualification and the skills. So can we really as industry work hand in hand with academia to ensure that some internship could be maybe towards the end of the semester or even in the medical colleges? Why don't we really come and shake hands with the medical colleges, nursing colleges, paramedical colleges, where we impart those trainings and give them on-the-job training by getting the people to understand about the responsibilities, how to do the things in the right way. So this is some of the things, and in our case, we do a lot of training programs, orientation programs. Each and every incumbent who's joining PathKind, we have started this program called as Udgam. We talk about sustainability, we talk about accessibility, we talk about environmental friendly things. So it's a 10-day residential program, which is each and every incumbent who's joining the company. Now, apart from that, we have got multiple programs. One is Sanrachna, where we are making our collection centers. So a collection center, typically, if you look at it, they generate a revenue of anywhere between 1 lakh to 5 lakh rupees or 10 lakh rupees at the max. So they're small-time entrepreneurs. Now, their aim is just to, they're very, very transactional in their approach. So how do we change that mindset? So we do a lot of stuff, and there are a plethora of multiple training programs that we do. Apart from that, we are using now the electronic medium, e-medium, very, very effectively to reach out to the people every now and then. We do, quarterly meetings, monthly meetings, depending on whom we are addressing to, all these things to, and my sense is that the pace is slow, but it's going to catch up. People are getting more and more discerning around the environment requirements and all, and I'm quite hopeful that things should improve over the next maybe couple of years, 2-3 years.
Yeah, in fact, a lot of employees are now pushing leadership and asking them what the organization is doing around climate action. So I think that's a step in the right direction, and so useful to know real use cases of how sustainability in action can happen through staff engagement, training, electrification of your fleet, and those are steps that one can really, any organization can take. But Satish, I'd like to bring you in on a point that Mr. Vishesh raised, which was very important, which was on compliance. And both there is a regulatory framework that is now in place, whether it is environmental law, company law, BRSR compliances, reasonable assurance. There's a whole gamut of, we can talk about it all day. What can healthcare leaders, managers do to ensure that when they promise something on the sustainability decarbonization front, it is actually being carried through and not just greenwashing? Some insights on that.
So healthcare sector, as we said rightly, the beauty of healthcare sector is scope. When we talk about scope 1, scope 2, scope 3 emissions, when it compared to other industry sector, any manufacturing or process industry sector, the elimination of scope 1, scope 2 emissions and scope 3 also very comfortable.
Yeah, sorry, Satish, I'll just like to bring in scope 1 and scope 2 are direct emissions that you are generating, and scope 3 is that you're getting through your value chain, just for the uninitiated. Yeah. Please carry on.
So the effectiveness of scope 1, scope 2 reduction for the healthcare sector is not so big issue, because they have their own kind of the carbon footprint. If you see, scope 1, scope 2, when it compared to carbon footprint, healthcare sector is very, very too low when it comes to other process industries. So adopting the green building concept from the design stage. Earlier, green buildings are costing around 8 to 10% higher cost than project cost, but nowadays almost 1% maximum or 2% maximum. So the adoption of green building concept for the existing building as well as for the new building is not a big issue, and the percentage of energy saving is 20 to 25%, and the water saving is also 20 to 25%. So the entire emission reduction, if you see specific your hospital wise, it will be around 15 to 20%. So the way forward is the adopting the green building concept for the existing as well as the new facilities. That is one thing. And sustainability part. So hospitals compliance, sustainability, if you see, statutory and compliance, these two are the linked terms for the environment, social as well as for the governance. So all electricity rules like IEC standards or ECBC standards, IGBC standards for the green buildings. So these will give the complete comfort for the healthcare facilities under safety and sustainability point of view. Here healthcare sector safety and sustainability is interlinked. So that is the reason. So we need to adapt the all sustainable measures as possible to the industry.
Right. No, that's very important.
Just to add to this, I mean, SOCHM themselves have started, kind of writing the norms for the certification process, and I have been instrumental in kind of writing the GEM certification program for healthcare buildings. Yes. And there, what we have done is that we have actually also looked at the practical aspects which were missing in, USGBC or IGBC, in terms of how the projects actually flow in the country, right? I mean, unlike Western countries where you actually design, do the whole documentation, keep it ready, and then you go in for certification. Here, the construction is happening, drawings have gone for sanctions, everything is running parallel. So we have kind of made the documentation process more conducive, and also have, kind of the National Building Code 2016, which was a major change from the earlier one. We've kind of integrated all of that together to kind of ease out this process of certification.
Right. So that's useful to know that it is available to us as healthcare administrators to take these standards and start building your decarbonization journey, sustainability journey for the built environment on those. We'll open up for a few questions, a couple of questions, in fact, in the interest of time. But I just have a last question to Manu, and it may seem prosaic, but it's important. When you build your plans towards sustainability, bringing in energy efficiency and energy efficient technologies, and I hope there are no CFOs in the room, you finally hit the hurdle of getting finance clearance for new projects or new technologies. And the question is there a trade-off? Is this going to be cheaper? Is this going to be more expensive? How does one answer those questions when you're investing in new technologies which may be energy efficient?
See, as I was responding to your earlier question, that an industry which is looking at 15, 16, 18% EBITDA, right? I mean, investing in something which saves energy and which comes in the tune of about 1.5%. I think that's a huge saving. And if you really look at, the simple elements which I spoke about in terms of chillers, lights, glass, etc., BMS, the payback is not long, right? I mean, I personally feel that it is cheaper, wiser to invest. It's not expensive. It comes in quite handy. The payback is a couple of years or something like that, and it works well.
Right. So there is a case both, I mean, if you don't think about the planet or you don't think about human health, if you just look at the bottom line, it makes bottom line sense as well. So there is a case, economic case also to get onto this journey. It's useful to know that, it can shave off a percentage and a half of your EBITDA margins, which is great. I mean, and also, as Satish mentioned, it has life cycle savings that it can accrue. With that, we'll end this part of the conversation. Happy to take a couple of questions that there may be in the audience. Sir, please.
Good afternoon, everybody. I'm Dr. R.K. Tuli. I'm pioneering the concept of holistic medicine. And since this summit is all about the future of healthcare, I recall today in 1995 when Dr. Pratap Reddy invited me to establish the Department of Holistic Medicine at the Delhi's Apollo. He said, this is the future of medicine in the next century. My question to Madam Purnima, you have taken so much pains to explain that how this climate is affecting our health, which is a product of our energy misuse, I would say. We have been very intensive use of hydrocarbons in the last century, which is resulting to the end of the planet today. And at the same time, my question is, what have we thought of? Here I have this WHO document in my hand on the World Patient Safety Day, which reads that medications are the most widely utilized interventions in healthcare, and medication-related harm constitutes the greatest proportion of total preventable harm due to unsafe care, let alone the economic and psychological burden.
Sir, can you please come to your point, sir?
So I'm coming to the point that there is a, while now we are having gone and used the energy, the fossil fuels, creating our climate to, we are waking up only when we are at the edge of the disaster. What are we thinking of the use of pharmaceuticals? Because as this document says, this is the greatest preventable cause of harm, and WHO Global Patient Safety challenges medication without harm. I don't think there is any medication in the world today which promises this Hippocrates dictum, primum non nocere. So what are we doing about it at the national level?
Absolutely, Dr. Any other question? Is there another question? We can take both and then we can... Is there another question in the house? Okay. Ma'am, please go ahead.
So I think you're right. I mean, it's a big domain that the health sector needs to think about, because we are so dependent on the pharmaceuticals, on prescriptive medicine. And also, I think we are the pharmacy of the world. So all the ingredients are manufactured in India. So I think we have a role to play in two different approaches. One is, actually making sure that all the manufacturing that happens in India for the pharmaceutical ingredients is happening in a sustainable way. And the reason that should be is because the communities that live around these units may also probably be exposed to the effluents that are coming from these units. And AMR maybe, this is a speculation, there is no evidence to show this, but it is an area of concern for people living in India, because we are supplying, I think 90% of UN procurement happens in India for the active ingredients. So in terms of actually the use of pharmaceuticals, I'm not in clinical practice anymore, but then I can definitely say there is scope for preventive medicine. Preventive medicine before getting to the curative. I think you actually mentioned it, one of you actually said, I think Mr. Vashishta actually said that, prevention is better than, getting people into the health system. And once you get there, I think we have to have sustainable forms of healthcare delivery. Prescriptive is one side of it, so reduce the demand for actually prescriptive cure and medicines. And when it comes into the health system, the burden, I think taking sustainable forms of healthcare delivery like telemedicine, I think is a tool actually to reduce the footprint of the healthcare delivery systems.
And in fact, the wider One Health system, which the WHO has now proposed, animal health, planetary health, and human health, are interlinkages, which is something that Dr. Tulli also spoke about. So thank you for that. Thank you for the insights offered by this fabulous panel. As always, I have gone away with having learned a few things and wiser nonetheless. So thank you everyone.
Thank you to our speakers for coming here and sharing their knowledge with everyone. A reminder to all of you to please stick around till the end of this conference. We have 2 more sessions coming up after lunch. You can collect your delegate back on your way out. So do join us again after the lunch break. Before we get into lunch, I would request Mr. Sandeep Jain to please present mementos to our esteemed speakers who have come here and shared their knowledge with everyone. Memento for Dr. Karan Thakur, Vice President, Sustainability, ESG and Public Affairs, Apollo Hospitals Enterprises. A memento for Mr. Manu Malhotra, Director, RSMS Architects and Chairman, ASSOCHAM GEM Green Healthcare Rating. A memento for Dr. Purnima Prabhakaran, Senior Research Scientist, Center for Chronic Disease Control and Director, Center for Healthcare Analytics Research and Trends, Ashoka University. Memento for Mr. Satish Suri, Managing Director, Green Path Energy and Sustainability Services. And a memento for Mr. Sanjeev Vashisht, MD and CEO, Pathkind Diagnostics. I request all of you to please gather for a group photograph. Big round of applause for our speakers. Thank you so much for coming here. We will slip into a 30-minute lunch break and we'll resume with our sessions after that. See you all after 30 minutes. In cities, access to healthcare usually means visiting a clinic or a hospital and paying from one's own pocket for the fees and the other charges that do come in clinics and hospitals. Do you think the same kind of facilities exist in rural India? Most of the times, the answer is no. A study has shown that most providers are in the private sector in rural India, about 86%, and within the private sector, the majority are informal providers or informal practitioners without any formal medical training. Quality standards are extremely important for healthcare delivery and management as they play a critical role in ensuring patient safety, improving healthcare outcomes, and enhancing the overall healthcare system's effectiveness. In this session, we will discuss accreditation of healthcare facilities, role of effective leadership, and management in strengthening and upskilling of the healthcare workforce in India. Please put your hands together and welcome on stage our esteemed speakers for this discussion. Please welcome Dr. Rajesh Kesari, Founder and Director, Total Care Control Delhi, NRC EC member, RSSDI. Dr. Kesari will be setting the context for us and he will be moderating this session. Please also welcome on stage Dr. Atul Kochhar, CEO, NABH. Please welcome Mr. Pankaj Johri, Director and Head, Operations Medical, NABL. Dr. Vijay Agarwal, President, Consortium of Accredited Healthcare Organizations, CAHO. Please welcome Dr. Girdhar Gyani, Director General, Association of Healthcare Providers, India. Ms. Shishmita Roy, Senior Scientist and Head of Quality and Regulatory, AMTZ. And Wing Commander M.K. Bose, Chief Executive Officer, Seven Hills Hospital. I request all our speakers to please be seated. I would request Mr. Sandeep Jain, Director, ASSOCHAM, to please present Dr. Atul Kochar, CEO, NABH, with a small bouquet. We are very grateful to you, sir, for taking the time out to come here and sharing your thoughts with everyone. So I would request Mr. Jain to please present a bouquet to Dr. Atul Kochar. Right, I'll hand it over to Dr. Rajesh Kesari to steer this discussion ahead.
First of all, good afternoon and welcome everyone after a very hearty lunch. And I'm sure that the session that we are going to have here with our eminent panelists is going to be definitely very interesting. Because what we are going to discuss right now is one of the most important aspects of medicine. We've been hearing a lot since the morning about innovation and sustainable solutions in healthcare. So actually, for all of us, as there was a question in the afternoon also, it all boils down to good treatment, good outcome, a healthier you, a healthier human being, your family, your children, your parents, how they can be healthier if they have got a sickness and illness, how it can be ameliorated quickly with least cost. I mean, not just least cost in the sense of financial, economic cost, but also emotional cost, pain. So all this has to be looked into. I, being a clinician, I'm dealing with patients, sick people. I see how they come in and the treatments they get, how they go out. So all this is very important. And this cannot happen just by itself. It is not a matter of you or anyone for that matter going to a doctor, the doctor seeing you, prescribing a treatment or doing a test, and you being healthy just after that. So there's a lot that goes into it. It's a whole ecosystem. It's the doctor, it's the nursing staff, it is the paramedical staff, it is the laboratories, be it pathology lab, be it radiological consultations. This I'm talking about smaller problems which help making the diagnosis. Then from there on, you go on to the treatment part. Again, you have a doctor. If it is in an illness which can be just treated by medications, it is some medicines, or surgeons, there are procedures. When there are procedures, there are a lot of medical devices involved. And now we heard that there are robots involved in treatment of such illnesses. So it is a very comprehensive ecosystem. And behind these hospitals, there's bio-waste management, energy management, a lot of things which go in together to give a good outcome. So if we have to improve the outcome of the treatment, the degree of the outcome, as was just being explained in the introduction of the quality of healthcare. So we have to look at all these aspects in total, not just one of it. And I'm very fortunate that we have specialists in almost all the associated fields sitting here on the dais with us. And I would like to start from the top. Because when things go really, really wrong, then we land up where in hospitals. Hospitals are the places which actually save thousands and thousands and thousands of lives in very, very difficult times. So I'm really glad that we have none other than Dr. Atul Kochar, who is the CEO of NABH. And I'm sure you must all be understanding what is NABH. And for those who don't, I won't say any words. I would request him to come to the dais and give an address. Dr. Atul.
Thank you so much, sir. Good afternoon, all. Respected Dr. Gyani, sir, Dr. Vijay Agarwal, sir, my dear friend, Mr. Pankaj, Madam, sir, and all of you. Thank you so much for this opportunity For all those who are not aware, NABH is the National Accreditation Board for Hospitals and Healthcare Providers. We are 18-year young body, and very, very fortunately today, the founders themselves are in attendance today. So none other than Dr. Girdhar Gyani. He was the Secretary General of Quality Council of India. So to understand the issue, as Mr. Keshri sir has very rightly pointed out, that everyone has to experience healthcare, whether it is preventive healthcare, whether it's vaccine, or whether it's a pandemic. Each of us, fortunately, unfortunately, will have to be in contact, whether as an attendant or otherwise, touch wood. We come in touch with physicians, we come in touch with hospitals, big or small. And about 18 years back in India, a need was felt that why shouldn't hospitals have certain standards? So then the job was entrusted to Quality Council of India. So Quality Council of India is a large umbrella body. Under that umbrella, which is about 26-year-old now, founded in 96, with a single line vision of creating an ecosystem for quality. So under Quality Council of India, of which Dr. Gyani was in charge then in 2005, the government put it up that please create standards for hospitals. Indian standards, not ISO, not GMP, not anything, but please create Indian standards which will be carried forward. So Dr. Gyani sir founded a board, just like other boards like NABL, NABCB, NABET. He founded NABH in 2005. And 2006, the first standard was. So when we say standard, what does it mean? Standard means from entry of a patient, let's say, inside the hospital, from the moment they see the outside to see the scope, to they walk the stairs or the ramp to the exit, and then follow up, including the facility, including the manpower. So everything which concerns a hospital or a patient or a staff was thought about and drafted into 10 chapters. So that is a standard. Starting from that one standard which he founded, and he was the first CEO also. So I'm very proud to be sharing the stage with you, sir. Every 3 years, NABH has been bringing revised editions, which we call it number editions. First standard, third, after 3 years, second edition, then third edition, and now we have the fifth edition. These standards have become very popular. Our first hospital was Birla Heart Institute in Kolkata, and then today we touch about 18,000 hospitals in India and 8 countries. So there are about 200 odd, 197 odd countries in the world. Only 43 or 44 have their own standard, and India is very proud to be one. So with that introduction, these standards cover and address all aspects of patient safety and healthcare quality. Why do we need standards? Standards are very, very essential because still, despite every advancement, despite Chandrayaan landing on the moon or NASA doing wonders everywhere, medication errors and unintended harm leading to death is still the top 10 causes worldwide. Millions of people die or suffer morbidity, serious harm because of unintentional medication errors, because of sentinel events like falls. Falls are very common in hospitals. You take the name, the best of the best hospital, and if they monitor it carefully, despite that falls occur, despite that hospital-acquired infections are a huge challenge. Everything. So these infections, which are multi-drug resistant bacteria or viruses, they are a very, very important cause of unintended harm. So keeping all those everything in mind, there's an effort, which is a very concentrated effort to devise SOPs. Now, sir said that SOP does not mean that you should not have empathy, you should not have compassion. That is the first duty of a doctor, that to prevent, to first do no harm, primum non nocere. That is an oath we take, all doctors take. But despite that, harm occurs. So how can we prevent that? So that requires concentrated capacity building, concentrated, again and again we have to meet people, tell them, sensitize them, everyone. And the day will come when every consumer or the patient, because every person is a potential patient, right or wrong. We hope they all will be healthy. So thank you so much to ASSOCHAM for inviting this, creating this event, and inviting all of us to debate on all quality in healthcare issue. Now, quality in healthcare issue is a very broad issue. There's an aspect which requires standardization, which my friend Dr. Pankaj Johri, he is from NABL, which is the sister board of NABH under Quality Council of India. They take care of not only testing lab, calibrating lab, but also more than 2,500 medical labs. So there's lots of quality goes in how tests are done. There's a requirement of capacity building, where CAHO comes in. Dr. Vijay Agarwal sir is the founder of CAHO. He is also one of the founder of Pulse Polio, which we all know so well. And he's also the founder of NABH, so co-founder. So with all these people, the single line vision here today is to discuss healthcare quality and how all of us can come together to deliberate, reinforce the continued wisdom and take it forward, and then also decide what more can we do or what more can be done to prevent unintended harm. So that is the basic essence of today's panel discussion. And quality in healthcare, I firmly believe, comes out of following SOP. So when there's a very famous surgeon whom I share my name with, Atul Gawande. He's a neurosurgeon at Mass General in Boston. And he wrote a book called Checklist Manifesto, which is a must read, very thin book. So that gives you reason why in healthcare, from handing over to taking over a patient, how when a nursing officer addresses the patient, how communication is effective, how to identify a patient. So all these things should be implemented in a checklist-based manner. And when checklists are done, then chances of a wrong eye being operated or a wrong foot being operated or wrong side being operated go down. Not only that, chances of hospital-acquired infections go down drastically. So standards are very much essential in healthcare and they should permeate. And today, there is no right number, but I suppose we have 1 lakh big hospitals. So touching only about 18,000 is not a big number. But still, it's an effort. And over the past 18 years, we have touched about 18,000 hospitals. And we also hope that going forward, we'll soon cover all of these hospitals with active support of our founding members of NABH board like ASSOCHAM. And thank you so much once again to the leadership of ASSOCHAM for this opportunity. Thank you.
Thank you so much, Dr. Atul, for your wonderful introduction of NABH and the importance of quality standards and how they can help in prevention of harm to the patient and how they can improve the outcomes of treatment of patients. So thank you so much for this. Now I would like to move the baton forward and bring the complexities a little bit down from hospital to how things are done in a hospital. We first of all must come to a diagnosis. And what is very important, especially in today's scenario, because majority of the deaths in our country today are being caused by non-communicable diseases. And a lot of these diseases like diabetes, hypertension, coronary artery disease, they are in some extent exquisitely based on laboratory diagnosis. So laboratory diagnosis has a very important role in hospitals, in clinics, in our day-to-day lives in managing diabetes, cholesterol levels, thyroid levels. So this is just to make things simple for everyone, even if you are a non-medico or from not a medical field. So the baton is over to Dr. Pankaj Johri. So tell us about the importance of standardization in blood testing. I understand that NABL is involved in calibration, in animal testing, in many other fields. But please give us a brief about the role of NABL in standardization of laboratories.
Yeah, thanks, doctor. And first of all, I am so privileged, in fact, when I'm sharing dice with Dr. Kochar, Professor Vijay sir, and Dr. Girdhar Gyani sir. Gyani sir has been our ex-SG also, and I have not got the opportunity to work with him, but I have read his book, and that book itself is a master and marvel in the patient care and safety. So thank you, sir, and thanks you and all my fellow colleagues on the dais. When talking about the importance of the diagnostic part, and doctor has asked particularly for the blood testing, but I would like to take you in the time of the COVID-19, just to emphasize on the importance of the testing overall, whether it is medical testing or so. So during COVID, when doctors were using PPE kits, right? And everyone was worrying that even though these PPE kits are there, doctors are getting infected. So how it is possible that these PPE kits or the gloves or any other the precautionary measures they are being taken in the physical forms as well, they are not so effective. So PPE kit, if you see, is a part of the healthcare system. Is it or not? Or only testing is a part, or testing in a medical laboratory, or an opinion by a doctor on the lab. These are not the only things. Everything which is in the healthcare delivery system, because that theme of this session is that only, everything which is entering into that system is a part of that. So right from the protective aprons, the gloves, to the medicine, the drugs, the infrastructure, the facility, the machines, equipment, the laboratories, the technicians, the doctors, the staff, issuing the reports, then expressing opinions, and starting the treatment also. Everything is a part of a healthcare system. So we need to take care of each and everything. Until unless everything is tested and is subject to a critical examination, and until the outcomes are such that they are satisfying a particular or a set limits or set norms, we are not allowing them to enter into the health Medicare system. So these set norms, I used the word set norms because now I will say these set norms are actually standards, right? Now coming for the what he has asked the question, for the biochemistry part, the blood testing also, for everything you see it. From the diagnostic angle, if you see, an error, it may be a small one, it may be the critical one. Right now, the emphasis of manufacturers, the medical device manufacturers and the doctors is on one thing, on eliminating the margin of error. You see, AI is there in everything. Why AI is there? because the manual intervention you want to be lesser and lesser. Why it's so? The error percentage, the bias which is expressed or which may be associated with the measurement, with the results which a laboratory is giving, that should be the minimum, so that a clinician, a treating doctor can have a conclusive approach and can start the right treatment. So this is the importance of the medical laboratories. I'm proud to say that NABL as an accreditation body has not only medical testing in its wing, is a testing, is having the calibration wing also. So testing of the medical devices, medical products, the drug, the medicines, the aprons, the protective wears. I'm talking in terms of the healthcare only. Then calibrations. The medical device equipment, whether they are giving you the right values, the thermometers, the gauges, the ICU equipments, etc. The result they are giving you, whether these are accurate or no. So everything, these have to be calibrated. And then the medical testing. For medical laboratories, whether the testing has been performed by the medical laboratory professional, as per the established procedures, set norms, standards, keeping the biasness and the error percentage to the minimum. It cannot be eliminated at all, but to keep it minimum, so that to facilitate the doctors and the clinicians to provide the right treatment to the patient, and so to maintain the patient care and safety at the topmost priority. Yes, doctor, please.
Thank you so much. I think that was a very comprehensive opinion about the importance of accreditation of laboratories, especially in the field of medicine, where there are so many factors involved in the treatment outcomes. And I would just like to add one more thing here, which I feel is very important, especially with standardization of laboratories and accrediting with an organization like NABL, that the results of different laboratories, because the patient may once go to one lab, then another lab, then the third lab, but the results that we get to see from these labs are one dependable. When we see the report, we understand that this laboratory has given the accurate results, because the treatment in such patients, let's say diabetes, cholesterol, heart problems, actually depends upon the numbers that you see printed on that piece of paper. We say that we treat patients, but in order to treat the patients, we depend on those numbers. So they are uniform. If you do a test at any of these accredited standardized laboratories, you will be at least having the faith and confidence that the numbers are accurate and they can be acted upon. So this is very important. I think this is also an important role of NABL accreditation, different laboratories. So since this topic is huge, but we have limited time, so I would move on forward. And I would like to ask Dr. Vijay sir, sir, is accreditation, standardization enough? In such a huge country as India, we have 1.4 billion people and few doctors, hospitals not sufficient, doctors not sufficient. We are talking about accreditation, standardization. Is that enough to bring quality healthcare to all?
Thank you, Dr. Kesri, and I'm also grateful to ASSOCHAM for giving CAHO this opportunity to share this platform with such illustrious people on my left and right. I bring you greetings from CAHO, which is a consortium of accredited healthcare organizations. We are just about 10-year-old, and in fact, we were born at the time of a second conclave of NABH, when Dr. Gyani was demoting his office, with an aim to bring the accredited hospitals together to help them in their continuous quality journey improvement. The question that Kesri ji you have asked is extremely pertinent, And that is what has been, I would say, the major thing for CAHO to be deliberating on every single day. And the issue is that, like Dr. Kochar also said, that the amount of errors, amount of those things which are occurring, and that is the reason why these standards and objective elements were made. But let's look at a data from United States, where there is an accreditation body which is 75 years or more in existence. Their healthcare budget is like the budget of our whole country, like the GDP of our country. It's 18 to 20% of their GDP is their healthcare budget. In 1999, the Institute of Medicine had published a report that 98,000 Americans were dying because of preventable medical errors. And ladies and gentlemen, you will be surprised that even today, medical errors continue to be the third leading cause of death in that country. We in India are very fortunate that we don't have a data like that. Otherwise, the public will lynch us. So the issue is that I can definitely say that accreditation all over the world has been a great tool, a great advancement towards sensitizing the healthcare community and everybody towards the issues involved in the patient safety. But then why is it that accreditation alone, or why accreditation is not answering the question? The issue is this: we are not trying to see that what's happening to the medical errors. Why are they not coming down? No, some of our analysis is that number of hospitals who get accreditation feel that it is the end of their quality journey, while it should be very clearly the beginning of their quality journey. I had the pleasure of being a co-chair of the accreditation committee of NABH for 4 years. And I can say that every time when a hospital was coming for a surveillance or a re-accreditation, instead of showing improvement, they were showing downward trend. So what was very clear, that all their efforts was to see that somehow we pass the exam of NABH. So the whole preparation start from about 3 months or 6 months prior to the survey or the assessment. So this has been one of the factors, I will say, that why, because the standards and objective elements, why they are not making an impact. The second issue is this, that this whole issue of NABH and JCI and all have sprung up a creed of people whom we call as quality managers. Now what has happened is that the people in the departments of cardiology, orthopedics, pediatrics, they feel that when it comes to you talk to them about quality, they feel that it is the job of the quality manager. The issue is this: the quality in any clinical discipline, if it is pediatrics or orthopedics or medicine, can only be delivered and practiced by those people. Somewhere our focus on involving them, they are not getting involved to the level that they have to understand that they have to become the captain of the ship. You see, our healthcare delivery at one time was only an affair between the doctor and the patient, and I used to compare it like a solo badminton game. Today, it has become like a football or a cricket, where there is a multi-stakeholder delivery. Everybody in the healthcare ecosystem is important. And this doctor who is practicing there has to learn that he has to be the captain of the ship. He cannot stand on the buy side and say, all right, oh, this has happened, he has no idea. So this is, to my mind, another factor. The third is that somewhere along the line, we have not really enthused or trained our community to demand quality. You see, unless or until community will start to demand quality, what is happening is community is demanding cheaper care. Government is wanting to provide cheaper care. Now, there is some basic cost of providing quality care. Now, there have been number of studies that even when it comes to the reimbursement of the government-sponsored procedures like in CGHS and many things,
they do not even fulfill 50%, 60% of the cost of doing that procedure. So obviously then the healthcare people, they start cutting corners, but ultimately everything is also an economic entity. If you want a hospital to survive, he has to survive financially. It is also a fact that when you work with quality, it is a lot cheaper as compared to when you are not going to follow quality. There is a huge cost of poor quality. But in the whole process, we lose lives, we lose limbs, and there are huge kind of problems. In fact, nowadays, this issue of patient safety has become so huge that the World Health Organization has started observing 17th of September as the World Patient Safety Day. And this year, the theme is to engage with the patients, to elevate the patient's voice. And this, I would say, is the right time, right year, when all of us are working towards how do we involve patients, how do we make them aware about their rights, but also of their responsibilities. How do we make hospitals aware that there is a need to take the patient's voice into consideration while we are delivering care. I think involving patients will also bring down the kind of errors that we are seeing. So this is a huge subject. We can kind of go on, but in a nutshell, all I can say is that a body like an accreditation body and a body like CAHO, which is there for working towards capacity building, we are working to see that every person in the healthcare organization understands the intent of the objective element and the standard, and not merely pass the exam when it comes to just coming to the assessment. And that can only happen when there is a continuous kind of a hand-holding about educating them. So this is in a nutshell, I can say that it's a great, I would say, great initiative of our NABH. We are only about 18-year-old in the country. It's a fantastic, I would say, organization, but we need to kind of not fall into the pitfalls that US has fallen, that in spite of spending more and more money, in spite of being there for more than 75, 80 years, the medical errors continue to thrive. We have to see how to overcome that challenge. Thank you.
Thank you, sir. Thank you so much for your views. Please give him a big hand. And medical errors are definitely a big impediment in creating good outcomes for our patients. And patient safety is always of paramount importance. I recollect those COVID days, you know, that we used to do a lot of teleconsultations. Dr. Kalhan was talking about in the morning. And the pulse oximeters had become almost ubiquitous. They were available in every household, a number of them. And once on a call, I asked the patient, as I would always do, that you have fever, you check your oxygen saturation pulse and show me. So I would get the picture. And the saturation is showing 64. I asked the attendant to check on all the different fingers, wait for some time, everything that we usually do. So the patient, the saturation was low on all the fingers. Now the thing is, if I would have taken it for granted that the saturation is very low, I would have said immediately, rush your relative to the hospital, to emergency, he needs a bed, ICU, CPAP, or whatever. So, but the thing is, doctors ultimately rely on medical devices, either in the field of diagnostics, or for treatment, or for surgery, or for that matter, for the simple measurement of blood pressure, blood sugar. If you go up further, now there are patches, now there are sensors for monitoring glucose 24 hours. In hospital, you have so many different equipments. You have infusion pumps and what not. So medical devices is also a very important aspect of the treatment of the patients. So we are really very fortunate that we have Ms. Sushmita Roy. She's traveled all the way from Andhra Pradesh and she is representing AMTZ. And she specializes in regulation of biomedical devices. So, madam, I would like to ask your opinion. How does our government ensure that the biomedical devices, especially the devices which land up with the people in their own hands, with which they do the, they can do some tests and arrive at some conclusions, like I gave the example of a pulse oximeter, that are they regulated? How are they standardized? How do we know that, that they are functioning as they should be?
Thank you for your question. Thanks, Ashokam, for organizing this beautiful workshop. Yeah. See, all the medical devices are highly regulated. Now in India, each and every medical devices are regulated. That is confirmed under India 2017. That has been implemented in 2018. So since then, we are practicing. Now you are taking an example of pulse oximeter, how to ensure that this product is efficient or effective for the end user or maybe for the patients. It is not simply a product, it is basically an assistance to the healthcare. So it has to be ensuring that the patient is safe and its reading or data are accurate. How do we do that? We have to, there are lots of standards. And all these standards are supposed to be evaluated. Before you put the product into the market, you have to ensure that the product has gone through lots of evaluations, which is required, which has been prescribed in BIS, Bureau of Indian Standard, and then you have to take that product to the laboratory. Once those certificates are here in the place, then this entire documentation goes to the regulatory bodies working under Minister of Health and Family Welfare. We have our regulator called DCGI, Drug Controller General of India. He then checks all the technical aspects, whether the product is eligible one to go to the market. Then only he will be issuing the approval. With this approval, we can ensure that the product is safe for public use.
Is there any way in which, like our listeners, can they look up at the product and say that this has been approved, this is good, safe or not?
Yes, of course, yes. One of the parameter is labeling. Each and every product, medical device product or healthcare product, has to be labeled properly. And that label also need to be approved by the regulatory authority. So on the label, you are expected to see manufacturing date, expiry date, shelf life, license number, and with this you can easily understand whether the product is single use, disposable, consumable, or the product can be used with the other patient like a pulse oximeter. It is just going to the fingertip. That's so that you can use this product for other patient as well, post sterilization or post doing that infection control. You can use it for the other patients. So those are the aspects need to be put it in the label very in a legible manner so that the lay person can see, have a look, and they can go for the uses.
Thank you so much, ma'am. Thank you so much for enlightening us. I think this is definitely a very vital thing for all of us to note, how to choose wisely the medical products that we use in our day-to-day lives. Now, moving on forward, we've been to the hospital and our tests have been done in an NABL lab. We've been to an NABH accredited hospital. And then we have tried to understand the importance of avoiding medical errors. We've also looked up at the accreditation of the equipment which is present in the hospitals. Now we come down to the diagnosis, we come down to the treatment, which is ultimately actually done by the human beings. Dr. Girdhar Gyani sir, you have been a pioneer in this field. You have been the founder of NABH and NABL, I understand. So I don't think there is anyone better who would tell us about the importance of upskilling and strengthening our workforce, how to make them perform better in the environment they have. Because there are a lot of things that we cannot change. Not every institution can even afford to undergo the accreditation. So what are your views on this, sir?
ओके देखिए बड़ा क्वेश्चन क्या है बिग क्वेश्चन ये है कि You know, it depends on, for example, 1975, ऑटोमोबाइल में हम लोग स्कूटर लेने के लिए 2-3 साल का वेट करना पड़ता था। धीरे धीरे उसके ऊपर एम्फेसिस आई, मैन्युफैक्चरिंग के ऊपर कंपटीशन आया, और आज आप देखिए कार हो या स्कूटर हो, बेस्ट ऑफ द क्वालिटी एंड बेस्ट ऑफ देम आर अवेलेबल। आप सिर्फ ऑर्डर करिए, आपके घर में आ जाता है। तो एक डिमांड एंड सप्लाई बहुत इंपॉर्टेंट होता है। हेल्थ केयर, क्योंकि मैं 75 से मैं गवर्नमेंट में ही हूँ, तो व्हाट आई हैव सीन, यू नो, जर्नी, कि जैसे हमारा कंट्री आज़ाद हुआ, दैट टाइम वी वर दी लो इनकम कंट्री। आजकल हम मिडिल में आ गए हैं, लेकिन उस समय हम लो इनकम कंट्री थे। तो एम्फेसिस कहाँ थी? रोटी कपड़ा मकान। दैट वाज दी आवर गवर्नमेंट पॉलिसीज। उसके 20-30 साल के बाद क्या हुआ एम्फेसिस? बिजली, सड़क एंड पानी। वो आप देख रहे हैं आजकल हम फेस उसी में चल रहे हैं, इलेक्ट्रिसिटी, इंफ्रास्ट्रक्चर, रोड्स एंड ऑल दैट। तो ये जो एम्फेसिस होती है हेल्थ केयर के ऊपर, या तो पब्लिक से आनी चाहिए या गवर्नमेंट की पॉलिसी से इनिशिएट होनी चाहिए। Now, of course, the government also works on the expectation or the needs or the demands raised by the public. So I think that has happened little rather too late. And if I start from this government, जो चल रही है इस समय NDA की government, तो I think 2014 में ही they put it in the manifesto, quality, universal health coverage, वो वहाँ से शुरू उन्होंने किया। And I think 2017 में new health policy was announced. And 2018 में वर्ल्ड्स लार्जेस्ट हेल्थ इंश्योरेंस स्कीम आयुष्मान भारत लॉन्च हुई है। ये वर्ल्ड की सबसे लार्जेस्ट वेलफेयर इंश्योरेंस स्कीम है। So what I'm trying to say now is that now we are on that path. Now in that journey, obviously we never realized, even when we launched the 2018, the Ayushman Bharat, to be very frank, I can tell you, we were not actually prepared. पता ही नहीं था कि हम कहाँ पर हैं। And when we started, you know, assessing the कितने हमारे पास number of beds हैं, तो we found that we had at that point of time only 1.3 beds per 1,000, जो कि होने चाहिए 3.5 per 1,000। आज luckily हमारे पास 1.85 bed per 1,000 है। तो धीरे धीरे now we are emphasizing and building infrastructure. तो इंफ्रास्ट्रक्चर में क्या आता है? हमारे पास अस्पताल होने चाहिए, डॉक्टर्स होने चाहिए, नर्सेज एंड पैरामेडिकल स्टाफ, जो आप सवाल पूछ रहे हैं। सो ऑब्वियसली द फर्स्ट एम्फेसिस है हमारे पास डॉक्टर्स होने चाहिए, जिसके ऊपर अभी बहुत, आई थिंक 2014 में अगर हमारे पास 50,000 MBBS हुआ करते थे सीट्स, आज हमारे पास 1 लाख MBBS सीट्स हैं। तो वो उस तरफ हमारा अभी ध्यान जा रहा है। नर्सिस की जो काउंसिल है वो भी हमने रिवैम्प की है। अनफॉर्चुनेटली आप देखिए इस कंट्री में पैरामेडिक्स के ऊपर कोई काउंसिल या कोई कमीशन नहीं थी। ओनली 2021 में पार्लियामेंट ने उसको अडॉप्ट किया है, एंड स्टिल नाउ इट इज इन द फेस ऑफ कंस्ट्रक्टिंग। सो कमिंग टू दिस पॉइंट, वी हैव नाउ वोकन अप एंड वी हैव अंडरस्टूड दैट डॉक्टर एंड नर्सेज आर वन पार्ट, but equally important, 40% of the workforce in a hospital comes to paramedic staff, जिसको आप टेक्नीशियन कहें, जनरल ड्यूटी असिस्टेंट कहें, हाउसकीपिंग कहें, सारे मिला के जो है हमारे 40%, they equally are important in supporting clinical work and mainly looking out for the service quality. तो ये जो फेज शुरू हुआ है, अब तक क्या हो रहा था, हम लोग इसको हेफाजत वे में ट्रेन करते थे। Now because commission has come, now there is emphasis, Health Sector Skill Council is working, National Skill Development Corporation also is working. Latest I would like to tell you is that now we have woken up to realize that world is looking at us to supply the allied healthcare workforce. I incidentally am now advisor to the NSDC for overseas deployment of the workforce. Actually, we have missed the bus, but sooner than later, अभी हम लोग उस पे आ रहे हैं। We could have supplied this workforce to the entire globe. जो unemployment की हम बातें हैं ना, employment की बात हो ही नहीं सकती थी। We could have really done it. But now I want to again emphasize that these measures of NSDC, Health Sector Skill Council, is now working at very fast track mode. And our emphasis is not only to train the people for our own requirement, क्योंकि you are right actually, skilling जो है वो इतनी important है because जो medical errors की आप बात कर रहे हैं, कई बार हमारा ध्यान जाता है कि डॉक्टर और नर्सेज की वजह से या they are responsible for minimizing the medical. No, sorry, even allied healthcare का भी बड़ा इसमें role होता है. I don't want to emphasize कैसे होता है, but you understand. तो अब उनको जो हम लोग ट्रेन कर रहे हैं अपने लिए, plus, sending them over the globe. So skilling is now a very important initiative of the government of India and and the health sector as such. And I can only say that soon, we'll be able to come up to next 3 to 5 years में हमारा target है कि इसको पूरा bridge करेंगे और we will achieve 3.5 beds per 1,000 population in India.
I think that is an ambitious and a very important target. The sooner we achieve it, the better. And it is definitely very encouraging, जो सर ने बताया है कि हम वो skilled force तैयार कर रहे हैं जो न केवल हमारे देश में हम लोगों की सेवा करेगी, मरीजों की, बीमार लोगों की, बल्कि दुनिया भर में हमारे देश का नाम रोशन करेगी. I was recently listening to an interview that in US, the Indian doctors, the Asian doctors, are one of the best doctors. They are the biggest taxpayers and the most disciplined citizens. And wherever you go in US and UK, Indian doctors are held in very high respect. So this is really a very encouraging standpoint. Thank you so much, sir. So now moving on further, I think one of the most important things that was talked about is change. Actually, what we need to change, because we already have establishment, we have established procedure, we have a way of living and functioning. When we come up against the standardization, that means probably at some point of time changing our methods of working, the way we work. So in order to bring out that change, not just bring it about, but to ensure that it stays there and it improves. I think Dr. Agrawal had talked about it, that it's not a milestone. Quality is actually a journey. It is not about reaching, but it is going further ahead and maintaining that. I think for that, leadership is very important in any institution. So we have with us someone who probably excels in discipline. He is from the armed forces. Wing Commander Bose, he's come all the way from Vizag. I would request him to tell us about the importance of leadership in management and especially in maintaining the quality of healthcare.
Thank you, and I would like to express my thanks and gratitude to ASSOCHAM for allowing me to share the platform and the stage with some eminent personalities of the healthcare sector. Leadership is something which has been spoken about right from ages and generations, because the success and failure of any organization, be it the healthcare sector or any other sector, depends largely on how the leadership is. And especially in a complex and multifaceted discipline like the healthcare, and it's very important and it's very pertinent that we have good leadership. So I would put it across that a leader should have certain qualities for which he would be able to take the organization forward. He has to be a visionary. He has to see what lies in future and not continue with what is going on. Because if the leader is somebody who is going to continue in the same tide as it is going on, changes will never happen. So we are fortunate that, as we have heard from some of the eminent personalities, that changes are happening, and that is very encouraging. So that's one of the major aspects of a leadership. And in a hospital or a healthcare sector, especially in a hospital sector, everybody is a leader. Because whether he is a manager of a small department or a surgeon, everybody has to be a leader. Because somewhere or the other, the person has to decide what he or she has to do, not being gender specific. Whether he is a surgeon to a sweeper, everybody works for one thing, and that is the patient care. That we always have to understand, and it has to get embedded into our minds and heart, that everyone in the healthcare sector works for one thing, and that is towards the patient care. Safe, efficient, and effective patient care. And a leader is one who will be able to guide the entire team towards that goal. And for that, he needs another quality, and that's called communication. He needs to be a good communicator. When I say communication, it does not mean only a one-sided communication, because communication encompasses everything. Verbal, non-verbal, and most important aspect of communication is hearing. Or somebody, when the person is speaking, a silent hearing. So it is not only to be heard, it should be constructively heard. And that's a very important aspect of a leader. A leader must be the one who should be able to communicate what he or she desires to do, what he or she desires his team to perform, what he or she wants the organization to think about, so that the organization moves forward. So in healthcare sector, as being so dynamic, we need to keep, abreast with all the changes that is happening. We had heard about quality. It's a very important aspect, because without quality, your deliverables will fail. The impact of treating a patient will be negative. So it is very important that we have efficient, effective, and qualitative patient care to get the desired impact. So the communication is one important aspect that a leader must have. The third one I feel is empathy and delegation. Because unless and until the leader learns to delegate the responsibility to every single department in a healthcare sector, I'm not going into other organizations, it is very important that the person upscales the level of knowledge, awareness of all his teammates within the organization, that everybody is able to take decisions. So not only the leader should be able to take good decision, he should be a good decision maker, he should also be able to ensure that his counterparts, his subordinates, in most of the hospitals, what it is seen, and most of the organization, it is seen is that some of the leaders do not wish to share the knowledge with his other counterpart, keeping it everything close to his or her chest, thinking that if I share this, I might have a downfall. So that's the kind of an attitude one has to be done away with. So he has to have he himself has to be a good decision maker, and he himself has to be one who will ensure that delegation of responsibility also happens. And for that reason, training is very important. Because to deliver qualitative results, we need to have upscaling. And how does upskilling happen? Upskilling can only happen when you have focused on training. In the armed forces parlance, we say, the more we sweat in peace, the less we bleed in war. So same goes for the healthcare sector. Because the more a person, whether he is a surgeon or a nurse or a paramedics or a housekeeping person, an administrative person, the knowledge plays a very important part in ensuring that the deliverables of the healthcare or the medical clinical facility is to the top quality. Because for a patient, he is seeing or she is seeing it from a perspective of how effective, how efficient, how qualitative, how cost effective, and how safe is your clinical deliverables. But from the administrative point of view, you have to see how well skilled are you to deliver those things. Are you trained enough? Are you aware enough? So for that, a leader should always have that thing in his mind, that he should ensure that training should be the integral part of all the hospital staff and the healthcare industry, whether in the community or outside within the hospital, they have to be well trained. Because unless and until a person gets trained, gets motivated, so motivation is another factor that leadership has to think about. He has to keep his staff motivated. So I think, we are running short of time. We can go on. But thank you very much for having allowed me this.
Thank you so much. Thank you
very much.
Thank you so much, Wing Commander Sahib. That was very interesting, very comprehensive. I'd just like to add that a real leader should lead by example. And if the leader has a passion and a zeal for quality, that will percolate down to the team, and that would show up in the work. So thank you so much. We are already running ahead of our time, which was allotted to us. But in conclusion, I would request all of our esteemed panelists to give short messages to our audience to take home with them. How can they improve, or how can we improve the quality of healthcare? We'll start with you, ma'am.
Improvement is a commitment, and you should know that whom we are going to deal with. It's patient who doesn't have any idea. So it becomes our commitment to give them the best and best.
Thank you so much. The Wing Commander, sir, would you like to give your short message?
The message that I would give is again the same, that quality is the most important aspect in today's healthcare. And I think we are getting to be more and more aware. Even the patient who comes to the hospital becomes more and more aware. So yes, we have to lay a lot of emphasis. Training, upskilling, and awareness generation is the most important, not only within the hospital, but outside the hospital, within the community, for them to know what is the qualitative aspect of a healthcare industry.
Thank you so much.
Thank you.
Pankaj?
Yeah, short message you were asking. Okay, short message is that quality, quality, and quality. That should be the theme, nothing shorter, nothing lesser than quality. One sentence you just allow me. Benchmark, we simply think that we have achieved the benchmark. But benchmark should be the minimum achievable things. We should always think of achieving higher than the benchmark. This is the message.
Thank you. Doctor?
So we've come a long way, but I think COVID has given us an opportunity, and policymakers have taken note. Things are very, very optimistic. And we have, over the past 18 years, let's say, we have managed to create so many islands of excellence. But total quality will not be reached until we reach out to the last in the line. We generate a concept of herd quality. Herd quality at a basic level, even if we have to do only hand hygiene, even if we have to do communication safety. So we have to reach far and wide and speak about quality, inculcate a mission of quality. Then there is no reason that we can be the top nation at Bharat at 100. I mean, that is the message.
Yeah, taking further from what Atulji said, we have to reach out to every stakeholder in the healthcare delivery to make him aware about his role. And more importantly, these all concepts of quality have to start from school level, from medical school level. It's extremely important for them to understand the role of empathy, role of coordination, role of working together as a team to deliver a kind of an end result. So it's an ongoing journey, and I feel collaboration is the key of reaching out or delivering success.
Yeah. You see, हम कुछ भी कहें, लेकिन 1947 में लाइफ एक्सपेक्टेंसी हमारी 40 इयर्स थी. आज 37 थी. एंड आज लाइफ एक्सपेक्टेंसी 75 इयर्स है. ये किसकी वजह से? हेल्थ केयर की वजह से ही हुआ है. तो आई थिंक इतना बुरा हमने नहीं किया है. रीजनेबली वी हैव डन वेरी वेल. अब सिर्फ एक मैसेज मैं देना चाहूँगा कि हेल्थ केयर तो और इम्प्रूव होगी, लेकिन अभी हमें वेलनेस पे ध्यान देने का है. इफ़ यू फोकस ऑन द ड्रिंकिंग वाटर, sanitation and nutrition and spend 1 rupee on that, we will save 5 rupees on the curative health. So our message should be to focus on wellness from now.
Thank you so much, everyone. And I would just like to add one point here, that our standards, our specialists are going to take care of you in the hospitals, in the labs, in the devices. But what is very important is that the sense of quality should start from your own self. आप अपनी सेहत का खुद ख्याल रखें, खुद ध्यान रखें, बीमारी से दूर रहें. It is much cheaper to be healthy than to fall sick, and it is all within your own realms. You can do it yourself with healthy food, with daily exercises. ये दो चीज़ें हैं, अगर हम बचपन से बच्चों को सिखा दें और खुद करते रहें, and if we be an example in your family, in your office, in your industry, I'm sure people are going to fall in line to start copying you, and the nation would be healthy, and we would be in need of lesser interventions and treatment. Thank you so much, everyone. Thank you so much to SOCHM for organizing this panel. Yes, please. One question. We are already very late.
or a minority itself. I think ultrasound should be made compulsory for every person by the India, and it should be free of charge. Once in 3 years, you will come to know what's happening inside, and it will record. I hope.
Being imported to India, who is certifying them? I remember very clearly in Corona, so many oximeters, they came from China, and they were faulty. So that was creating problem, like doctor said. Okay.
Yeah, I would request for you to take your questions on a one-on-one basis. Big round of applause for all our speakers on stage for sharing their valuable insights with all of you. I would now request Mr. Jain to please come on stage and present mementos to our speakers on stage. Would request you to please present mementos to Dr. Rajesh Kesri, founder and Director Total Care Control Delhi, NCR-EC member, RSSDI. A memento for Dr. Atul Kochhar, CEO, NABH. Memento for Mr. Pankaj Johri, Director and Head Operations, NABL. A memento for Dr. Vijay Agarwal, President, Consortium of Accredited Healthcare Organizations. A memento for Dr. Girdhar Gyani, Director General, Association of Healthcare Providers, AHPI. A memento for Wing Commander M.K. Bose, Chief Executive Officer, Seven Hills Hospital. And a memento for Ms. Shushmita Roy, Senior Scientist and Head of Quality and Regulatory, AMTZ. I would request all speakers to please gather for a group photograph. Big thank you to all our speakers. We will like to remind all of you to collect your delegate bags after this summit ends. So please remain seated and listen to the deliberations of the last session that we have now, and do collect your delegate bags on your way out. Let's move on to the last session of the day today. And this is Funding Fuel, Accelerating Capacity and Scale Up of Healthcare Ecosystem in the country. In this session, we'll be talking about creation of PPP models in healthcare for accessible and affordable healthcare for all, non-dilutive funding and creating the funnel of innovation in Atmanirbhar Bharat, early stage equity funding and gap in quantum of the risk capital, and growth capital and funding scale up for healthcare providers. So these are some of the important issues that we're going to discuss, including the way forward for ensuring access to capital critical for achieving the goals of healthcare transformation in our country. So please put your hands together and welcome on stage our speakers for this session. Please welcome Ms. Pushpa Vijay Raghavan, Director, Healthcare and Life Sciences, Sadhguru Management Consultants. She will set the context for this session and also moderate this session. Please welcome our other speakers for this session. Mr. Namit Chugh, Principal, W Health Ventures. Dr. Vishal Gandhi, Founder, Director and CEO, BioRx Ventures Advisors PLC. Mr. Rahul Agarwal, Managing Director, Quadria Capital. Mr. Chirag Sachdev, Principal, CX Partners. Dr. D.K. Gupta, Co-Chairperson, ASSOCHAM National Digital Healthcare Task Force and Chairman and Managing Director, Felix Hospital. And Dr. Sunil K. Khetrapal, Director, Association of Healthcare Providers India, AHPI. Big round of applause for all our speakers on stage. I'll hand it over to Ms. Vijay Raghavan to steer this discussion.
Thank you. You know you've had a good start to your panel when all the panelists look so happy together. So I think on that note, I'm happy about the composition of this panel. It would be one-sided to talk of funding fuel if you just had investors or the money takers. So we have a very, very balanced mix here with, growth-oriented healthcare delivery leaders, healthcare delivery association leads, as well as, investors across early stage to growth stage continuum. I'm going to start off requesting the investors on our panel to briefly, very, very briefly give us an overview for what their investment thesis is, what their fund does, and what space they invest in. I'll look to my right and request Chirag to get us started.
Hi, good afternoon, everyone. I represent a fund called CX Partners. We are a mid-market private equity fund. We focus on what we call buyouts, which is we essentially take more than 50% stake in companies. During this process, we put in our own management teams and very actively stay involved at the board level on certain operational matters, but more strategic matters, which could include acquisitions, IPOs, etc. So very hands-on investors. Healthcare and pharmaceutical is a key area of focus for us, where we've done multiple investments. So it's very good to be here today and look forward to exchanging thoughts.
Thank you, Chirag. Rahul, can I pass it on to you?
Hi, everyone. I'm Rahul Agrawal. I'm a managing director with Quadria Capital. Quadria is a healthcare-focused private equity fund. We happen to be one of Asia's largest healthcare-focused investor. We invest 50% in India, 50% in Southeast Asia, across anything to do with healthcare, hospitals, pharma companies, med tech, med devices, health tech, anything to do with healthcare. 2 offices, Delhi and Singapore. I'm based in Delhi office. Thank you to SOCM and all the fellow panelists for the opportunity. Thank you.
Thank you. Namit, you're the third investor rounding us off.
Good afternoon, everyone. I am Namit. I am a part of a fund called W Health Ventures. We are a $100 million fund investing in seed and Series A in both India and the US. Pretty much invest as the second or the first institutional check in any company. The intent is to back 2 types of companies. First is to do care delivery first companies, which go after a disease or a therapeutic area and kind of go deeper and deeper. And second type of companies largely are tech first companies, which are building from India for the rest of the world. We are strong believers that whatever IT services kind of did for, for US a couple of decades back, healthcare, same story can be replicated in healthcare now. We also have something known as a venture studio, which is called 2070 Health, India's first healthcare-focused venture studios, wherein we are creating companies from scratch. So those are kind of 2 parts of our investing and building thesis in India as well as in the US. Thanks.
Thanks, Namit. We're going to start off talking a little bit about the investment trends and then go to the industry perspective and early stage story. So I'll turn to Rahul here. Rahul, you seem very, very excited about the space, and we've seen a steep level of deal activity. The numbers are exciting, but can you break that down for us? The PE investment in healthcare delivery services overall, is that the kind of momentum that's going to continue? Is that momentum real? Is this euphoric feeling here for good?
Yeah, sure. So see, we remain very positive on the overall healthcare story. All the subsegments of healthcare are growing well. I mean, most of the people here are from healthcare, so don't need to delve upon that too much. But I think healthcare services is an interesting segment. 3-4 years back, and some of us here would agree, not every investor wanted to invest in healthcare services. It was a bit of a rocky road, both coming out of some pricing caps in certain segments. But last 2 years, if you see, the number of deals has outnumbered probably what happened in the last 10 years. So significant interest has come in, and for the right reasons. I think post-COVID, there's been a very strong trend towards high-quality healthcare So both the payer pools and the user pools focusing on high quality healthcare and adoption of healthcare services, proliferation of healthcare services, and thanks to policy initiatives like Ayushman Bharat, other state-run health insurance schemes, which have really taken healthcare deep down into tier 2, tier 3 cities. So this is one trend which has emerged very strongly. And we think that healthcare services, and see, hospital is a perfect example of whatever gets consumed in healthcare is present in a hospital. You have pharma, you have medical devices, you have medical consumables, you have insurance, anything to do with healthcare, health tech, e-commerce, healthcare e-commerce, everything touches hospitals. So I think this trend will not only continue, but should likely grow. And it will also then support accelerated growth for everything in healthcare, pharma, medtech, devices, insurance. So very strong trend. The problem right now for investors is that probably all the good healthcare delivery chains of size have either done IPOs or strategic sales or investment rounds have happened recently. So probably there will be a new round of investment into building the next set of regional leading chains for the next 4-5 years. But the wave of consolidation is going to stay, because you talk to any major hospital chain, any major hospital chain, any major healthcare investor in the country, everyone is looking to invest in the sector. So very strong undercurrents.
Sure, thank you. I see Dr. Gupta nodding his head. I'll come back to him, and I can guess why. He is on an inspiring journey himself. Okay, so I will then turn to him. Dr. Gupta, we have an investor here saying that the next set of investable regional leaders are getting built, as we speak. You have a great vision to take 200-bed, foremost coming to this 200-bed performance that you have today within a short span of time is commendable. You have a great vision to where you want to take this to 800 beds in a fairly short span of time. Can you articulate that, because it sets the stage for the energy in the healthcare delivery sector?
Thank you so much. Thank you so much, ASSOCHAM, for giving me the opportunity, and I'm very happy to be part of this session. I think we should understand what is that perspective of healthcare in India. Right now we are having about 1.4 billion people, around 140 crore. Out of them, 70% resides in rural area, that is tier 2, tier 3, even that tier 4 cities or tier 4 villages. And our healthcare infra is confined to tier 1 cities. That means 70% of the hospital, doctors, beds, ventilators, everything that is confined to maximum top 20 cities of India. And rest of India is lagging behind. They are not accessible. They are not having affordable healthcare services. And we talk about overall healthcare industry. Indian government invests around 2.5% of its GDP from last couple of years only, 2.25 to 2.5 right now. For last 70 years in this government, or whatever that government was, we were investing around 1.1% of our GDP, 1 to 1.25% of GDP. That is lowest globally. If we talk about the BRICS countries, they invest around 5%. Every country except India. I think today Prime Minister Modi is attending BRICS conference. And WHO says it should be more than 5%. Even if we talk about developed countries, they were investing more than 10 to 15%. Italy, we have seen what happened to them during COVID pandemic, America, US, Europe. Even most of these developed countries, they are providing free healthcare services to their more than 95% of the citizens, being NHS or any other healthcare scheme in these developed countries. In India, about 62% 2-3 years back, currently it is around more than 40%. We are spending out of pocket for gaining our healthcare services. And for that, people have to sell their houses, they have to take loan, they have to sell their jewelries. So I think there is a huge need of healthcare transformation in whole country. For that, there is one point, it cannot be done by Government of India, because 70% of the healthcare infra, being hospital, beds, OPD services, lab, diagnostic, that is purely dominated by private healthcare. Only 30% of indoor patient, OPD patients or lab diagnosis is provided by Government of India or government sector. So that's why government of India or a state government, they have to work together with the private players to provide universal health coverage to their population. Without private-public partnership, without empowering private healthcare sector, it is not possible. And I will urge the private equity players, investors sitting here, this is a heavy asset model, capital-intensive model, we all know, and incubation period is quite high. There are so many challenges also to acquire land, to acquire land, to make changes in their legal title or earmarked land. There is a plant machinery, building it is very heavy, incubation period high. Even we need very skilled manpower, be it medical, non-medical or paramedical. If you go to tier 2, tier 3 city, it becomes more expensive. In tier 1, it is at least it is affordable. So that's why if you want to penetrate in tier 2 or tier 3 cities, definitely we need relief, we need support from funds also. And now they are opening up. And for like me, I am a doctor turned entrepreneur. I started my hospital with zero funds, and we started from zero, and around 7-8 years back with a negative working capital of minus 15 lakh. Currently, it's 200-bedded hospital, occupancy is more than 80%, EBITDA is at 28%, ROS is 15%, and Google review of patient review is more than 4.7 from more than 20,000 customers. And if we talk about the growth CAGR, we are growing at a CAGR of 64% as compared to industry that is growing at a 17%. And despite all these benchmarks, I approached so many private equity players. Nobody supported. But I was persistent, I was having passion. I approached so many banks, nationalized, private banks, and they supported us. From these, now we are having a bit of positive EBITDA of 40-50 crore this year, grown at least 30-40% average growth every year in revenue or top line or bottom line. So I think there should be some confidence level, some trust level from these players also, from angel investors, VCs or private equity players, or government is supporting definitely, but because of long incubation period, heavy asset model, and lots of failures also in hospital industry in past because of, it's not because of healthcare entrepreneurs, it's not because of those who are managing, it's because of there are poor rate, poor quality services from Government of India. They are providing CGHS patient. They are not providing money on time. They are showing we are in MSME, but they are paying after 1 year or 2 years of our payment. So I think the huge infrastructure, a huge ecosystem needs transformation. They need to work on, to review it, to do root cause analysis for each and every aspect, and do corrective and preventive action so that we can be ready for at least fighting if there is any pandemic like COVID. We fought very well, but definitely there was a very huge scope to improve our performance in past. We have seen what happened in the rural area. We don't know how many deaths were happened in the rural area, or they were captured or not captured. Everybody knows. To prevent these type of casualty, to prevent our future generation, I think there is a huge scope. If we talk about private equity player, there are so many growth drivers. Like we have a huge potential of population density, 1.4 billion. There is a transformation from communicable disease to non-communicable disease. 50% now patients are suffering from non-communicable disease, diabetes, hypertension, cancer. 60% deaths are occurring because of non-communicable disease. If we talk about curative healthcare, preventive healthcare, now we are working 90% of our funds budget is on 90% on curative healthcare. If we talk about the Western countries, they are now at least 30-40% they are investing on preventive healthcare. Now this is era of preventive healthcare. Not preventive, it is predictive healthcare. We know there are so many AI tools, there are AR, VR, virtual reality, so many things we can integrate with our current system. Now government is also working on AVDHM, Ayushman Digital Health Mission. All data can be integrated. There can be intra and interoperability in the healthcare system. And with the help of these AI tools, we can predict each and everybody, whoever sitting in this room or whoever sitting outside this room, what risk factor they are having, what prediction is for their disease, what prevention, what steps they can modify in their lifestyle so that these diseases can be prevented. So I think future is huge, and because of these all technology-enabled tools, I think huge scope for this healthcare system to transform, and we need support from Government of India also and state government, also from the investors. Thank you so much.
Thank you, Dr. Kumar. Chirag, I'm going to turn to you. there is the broad optimism and there is, opportunity that's pervasive. But within that, what are those spaces where you're seeing greater merit for near-term investment as a private equity investor? Single specialty has been gaining traction. Does that also resonate with you? Is there, are there other spaces that are particularly more attractive within that overall continuum of opportunity?
No, thank you for that. And you know what Dr. Gupta was mentioning about multi-speciality hospitals being capex intensive, long gestation, large capex are all true. Which is why, as an alternate, one of the areas that private equity investors are increasingly looking at is single specialty healthcare, which is specialty outside of multi-speciality hospitals focused on one single specialty. The way we look, at least the way I look at it, is not a broad-based single specialty. There are, from a framework perspective, there are 3 areas that we look at from a single specialty perspective, which we call our filters. One is scalability of the company. How scalable is this organization? Can it grow from 50 crores of revenue to 300 crores of revenue? And how quickly can it grow? That's part number 1. Part number 2 for us is how capital efficient is it? For every rupee of money that I've put in this company, what is my payback period? How many years will I take to get that 1 rupee back and then make returns on it? And the third framework we look at is this specialty something that can be done outside a multi-specialty setting? Is there any reason why this particular specialty is not becoming popular inside a multi-specialty setting? And once you apply these 3 filters, there are a bunch of options that open up to you. Let me just give you some examples here. Scalability, for instance. A nephrology chain, for instance, if you look at it, these are neighborhood kind of procedures. You won't travel 55 or 100 kilometers for a dialysis, right? Birthing, again, very neighborhood. You won't travel 100 kilometers for a birthing to give birth to a child, right? So scalability here remains a challenge. Look at nephrology, the largest chains, Apex Kidney Care, NephroPlus, their largest centers would be doing 2-3 crores of revenue, which is not significant. So to get to 300 crores of revenue, you'll have to open 100-150 such centers. So operationally, it becomes very, very challenging, these kind of businesses. Second is cost of capital or capital efficiency. Oncology, for instance, is if you start something in single specialty in oncology, very capex intensive. It's as capex intensive as a multi-specialty setup per bed, because you need a cardiologist, you need a surgeon, you even need a neurologist. To staff, of course, you need your regular machines there. So again, very capex intensive to scale every new center. The third filter that I told you about was, are there areas which are not being successful inside a multi-specialty hospital? So right now we are in the middle of buying out an IVF business, fertility business. What we realize that there is this stigma around privacy. So women do not go to a multi-specialty setup for an IVF or a fertility question. They prefer going for privacy reasons, they prefer going to a center that is only focused on fertility and IVF, right? For eye care, for instance, for glaucoma, for a LASIK surgery, you won't go to a multi-specialty hospital, right? You'll go to a eye care center nearby, right? So once you apply these 3 filters, you'll realize that there are certain specialties, single specialties, that are more private equity friendly than other single specialties. Which is why you see a lot of deal activity, for instance, in eye care, because it is scalable, it is capital efficient, and it's not something that you can do inside multi-specialty setups. Similar is the case for IVF. You know, we had one of the largest IVF transactions in the country a month ago, which is Indira IVF, which is funded by a larger private equity fund. So these are the filters that private equity investors look for when they look at single specialty.
Thanks, Chirag. And it's a trend that's here to stay, right? Because there are several verticals of single specialty where you're actually perceiving that lever of scalability to be true across the country. The other element that's coming up in conversations is quest for capital efficiency, and the whole integration of digital solutions is also paving the way for that. We've two voices here on the panel talking to early stage. Vishal, who's been working in the space for a long time, raised capital for several young ventures. And not just now when it's a lot more fashionable, I think even before it became so hot. So Vishal, as you just reflect on how it's evolved, is there angel money today that's more than before? Has the flow of ventures expanded in terms of disruptive digital solutions that can transform the space? And how do you see the space when you reflect on how it's evolved?
Sure. Thank you, SHM, for the opportunity. So, I have a very distinctive career. I started my career with Dabur Research Foundation, floated a venture when I had no idea about business called OnQuest. And then, of course, I moved to Ranbaxy, floated a genomics company for them. And then I realized that, too much of research is not cup of my tea, and started working on, IP. And then again, I wanted to become a patent agent, and I realized that, patenting is not something that I would be good at. And then I plunged into venture financing by doing my MBA. From, looking at the lens of 6 years working with the two interesting pharma companies of that time, to 6 years spending time in corporate bank, which was one of the most aggressive healthcare bank. And I'm sure all of you know about Yes Bank. And I think 2006 to 2012, there wouldn't be any good sizable name we would not have funded, whether it's from pharma perspective or from a hospital perspective. Very proud to be associated with Medanta Hospital when actually Dr. Trehan was setting up a hospital. So it was only Yes Bank actually at that time. And I wouldn't really say that I was only responsible, but we took a lead in actually funding him 250 crore. The moment we put a term sheet of 250 crore, other PSU banks came forward. And we saw that, what actually it is about funding healthcare, right? Funding healthcare is not funding any other sector. And I think somewhere I still feel that with the passion that I started BioRx, with the aim to be a bridge between the investors and the healthcare community, I see the gap still remains the same, even what it was 10 years ago. So today, Dr. Gupta gave a wonderful pitch, right? And we all know what he's doing is phenomenal. But also, we must also understand as a healthcare person that where should I be going at the right time, at this right cycle of my life cycle of a company. So if we go and approach a private equity investor like Rahul would certainly love your talk, because you understand that you are fulfilling all that. But where is the game plan? Where is the growth plan, right? And maybe at some point of time, they'll probably like to invest into you. But if you keep hitting the private equity guy at a stage when you should be hitting some banker, because at the end of the day, Doctor, with due respect to sir, banker is putting in money because they know that there's a collateral associated with you. They have a brand equity, right? But at least at some point of time, you should be looking at who's the right funder for me, I think the way, most of my able fellow investors put in money, I think they also look at 100 companies and they invest in one. Should you also not be doing due diligence on investing, that who should be my investor? I think this is where sorry to say, I have supported at least 100 plus startups in last 11 years of my journey. Most of the startups didn't know who's the right investor for them is. Guys, I think gone are those days. Even healthcare entrepreneurs need to also do mining. That who's my right investor, right? And the same way, investors also do due diligence before they invest in you. And that is where I think the right marriage will happen. Otherwise, this complaint that, this guy doesn't give me money or this company doesn't, becomes investable, I think we need to step up, and we need to, there's much more to do, right? And whether it is about IP, whether it's about team, whether it's about various other factors which are very important to see the scalable business model. Now, if you have one hospital, sir, and if you don't have a growth story to have 5 more hospitals, now why do you need funding? Let's be very practical. You are generating 30% of EBITDA. I'm sorry, I'm just doing a very open challenge, because since I come from a healthcare field myself, and I've seen the balance sheets of almost like 200 hospitals, and I completely agree with Chirag that what he mentioned, the single specialty is so scalable. Like we've supported early startups in the dentistry, we've supported something in eye care. Now you've seen even these companies going for IPO? Because, there is a base of asset light, right? When you create an asset-led model, then, the scalability becomes a challenge. And if you're not scalable, and if your parameters are not scalable, and if you don't have a growth plan where one needs to actually use money to create better ROCs, one of a very interesting transaction I'm sure you are aware about, a Clear Medi Hospital which got acquired by Morgan Stanley, and I was really first advisor to them to actually see how I can turn around the company. Earlier they used to use the name called ABCD Clear Medi, but then we realized that the perception of that is very different, but we turned that calling Clear Medi ABC, and you won't believe, just by nomenclature and looking at the structural component of the company, and we were able to attract funding from a very good pedigree investor. Of course, it took us 4 years to restructure everything, but then all healthcare business models do not need money. I think there is a way to grow organically, and organically is also the best model, right? How many of us actually need money? We should also be very clear that how much money we need, what is the end use of that, what kind of investor, return we can generate. Please understand, the healthcare people do not understand how private equity works. Guys, please take a crash course of how equity works. Because if the day you get to know that why they're investing in you, and if you are in that matrix, I think you will have a better signal than a noise. Otherwise, we will always have a complaint. And I think we are all part of the ecosystem, and we need to really work cohesively to scale up businesses. And if we don't scale up businesses in healthcare, given that we have an opportunity to serve 1.4 billion people. Every one of us sitting in this room, and I'm sure some of you are startups, can play an integral and a very important part to deliver healthcare to 1.4 billion people. Because it is not the only government which is going to do it, it is people like you. But again, create models that are efficient, create models which are asset light, create models where you actually need investment, you will get it. But, you got to have, like a contours which will make your business model investable. So I think I've said enough. And, I only want to say that, if you have an investable startup, don't worry, people will chase you. So create, become a magnet. Yeah, if you're not investable, even if you hit 100 doors, you will still not get investment. This is my learning working with 3 startups a day. And this is my passion, and I would like to see how technologies at the end of the day move to the bench side and the bedside. Because just developing technologies is not the only solution, You need to have a team to be able to translate that technology into market and then create impact. And my favorite punchline is, it's the idea to impact which is more important, because ideas, anybody can come. Even we could have raised money for our own idea, but we are not as capable as you. But I think you have that grit, you have that youth power. So please do your research. That's my motive, and that's the message I want to give clearly. Please do your research for the right strategic capital provider for the business model you are in. We are in healthcare, but within healthcare, there are 30 business models. But do research, and you will hit the right person, and you will get the commitment. I am 100% sure about it. This is what has worked for me, and I'm sure it will work for you as well. So, Pushpa, back to you.
Thanks, Vishal. Dr. Gupta was picking up the mic, but I requested him to take that conversation offline, and I'm sure you guys will have a good coffee together and have fun. I see that coming. But anyway, I'm going to turn to Namit here. Namit, I think while they're going to have coffee later, I think the one thing that stays behind is that we need scale, we need scalability, right? And the only area I think everybody on this panel agrees is that we need innovation for capital efficiency as well as access and affordability. And you seem to be quite buoyant about it. You're writing checks for that. So where are you seeing, we've seen the pipeline of innovation, but scale has been amiss. How is that changing? Are you seeing digital innovation ventures going to scale? Are they realizing value? Are they generating revenue? And here we're talking beyond e-commerce and e-pharmacies.
I think the panelists have made a very interesting point around healthcare being capex heavy, and it's very asset heavy, requires gestation period, and hence technology is the only way we can address some of those aspects. What we are seeing is, again, a form of single specialty. Chirag and Rahul both alluded to it, But what we tend to call it internally is vertically integrated asset-light single specialty models using technology. And what that means is that you go and cater to one disease area and capture the entire lifetime value of the patient, but have a tech-first approach to solving some of the things. I completely agree, like for some of the models, you do need physical infrastructure, things like IVF, things like eye care, dental, but what we are seeing are some of these new age specialties, things like diabetes care, things like mental health, wherein you can solve a bunch of things virtually, and obviously you need to have some physical infra for catering to the complete patient value statement, problem statements, etc. So I think technology is one lever which can help accelerate access to most of these people and also address the asset-light, asset-heavy problem. To your second point around scalability of these models, at least in our experience, we have invested in 12 companies so far. I think it takes a bit of time in healthcare in general before you create a brand name and a patient trust for companies to scale. And hence even digital health is no different. But what we need to keep in mind, and as a fund, what we very, very closely track is patient outcomes, or clinical outcomes, so to speak, and also patient love/NPS, to make sure that the companies are actually addressing the problem statement that they are designed to solve for. I'll give you an example. For a diabetes company that we have backed, HbA1c reduction is the only metric that we care about. And once the company is proving that over and over again, more and more patients are kind of coming through the door. I think that becomes very important in healthcare even from a scale standpoint. You need to keep the clinical outcomes at the core of what you are building. Another trend that we at W Health are bullish about is building technologies from India for the rest of the world. And this could be artificial intelligence first or otherwise. And the reason for that is adoption in the West for something like this is much stronger and higher compared to where we are in India today. And B2B providers, hospitals, legacy providers, insurance companies are willing to pay for some of these solutions. We have again a mental health AI company which is building for the rest of the world, and I think it's the need of the hour to build in that space. So I think those are some of the levers that I feel technology can play an important role on, and hence that keeps us bullish about the space, and we continue to innovate and invest in the space.
Thanks, Namit. Rahul, you were optimistic about the medtech space. Do you see, the challenge there has been limited investment depth. There have been fewer companies at scale. Are you seeing the pull factor in terms of healthcare delivery growth impact medical devices and diagnostics? Is that a space you perceive more investments happening?
Sure. So, before I answer that question, just to delve onto the discussion so far, we actually believe that multi-specialty hospitals are also very investable models. We have, in the past 10 years, done a mix of both multi-specialty and single specialty. Multi-specialty hospital investments have done well. We continue to evaluate multi-specialty hospital models even today. Depends on the model, how it is run, and returns can be created. India is a very ripe market, very potent market. So we actually are bullish on multi-specialty hospitals as well. Now coming to medtech, I think this is a very interesting sector, medical devices and consumables. Again, I'll not go into a bit of too much of a background, but we actually believe that the Indian pharma, the generics pharma success story which got created in the last 20, 30 years, there is a good potential for Indian medical device and consumable companies to replicate that success story in the next 10 to 20 years. We've been investing in India for the last 13, 14 years, and even 4, 5 years back, it was difficult to find good opportunities of scale and good growth potential, and which didn't even have too much adoption in India, leave aside export markets. But post-COVID, because of again a variety of reasons, we've seen sort of an inflection point, and many interesting companies are doing a lot of good work in this space, both in the domestic market and export markets. They've really upped the curve on technologies, production technologies. They're investing in R&D. Again, it's sort of comparable to the generic pharma R&D. Nothing path-breaking over there, but more like generic pharma R&D, which is not very expensive to do, not very difficult to do. And Indian companies have now really figured out how to do it well. They're also many of the companies are playing a very smart marketing strategy as well on that, right? Which is winning adoption from Indian doctors, Indian consumers, and export markets. Plus, again, all that China plus one, diversify the supply chain, don't depend on one source or one country. So we actually are very bullish on that segment, and hopefully in the next 10, 20 years, you'll see similar success story as Indian pharma over the last 20, 30 years.
Thanks, Rav. Shall I see you wanted to add? I'll request you to keep
sure.
it brief. Yeah.
So, I've been supporting a lot of medtech companies. So I think what Rahul mentioned is about medical consumable companies, And when I talk about medtech companies, these are companies which have global patents. They have, regulatory approvals in place. But do we have scaled up business model in India around medtech? I think there's a challenge. There's a challenge of doctors acceptability that product, There's enough money which government has spent in developing those innovations too, but we don't see that doctors adopting it. I don't know what the reason is. One of the major problem that Niti Aayog is today struggling is that we are funding so many startups in medtech, and this is what they've done for about 12 years, but there is no uptake. Even the government public procurement does not have a preferential access to the medtech products. Today, what we are is actually a medical consumable hub, and I think we are not really there, but we can be there provided, if there is a capacity to scale up business models, and I think India has that kind of innovation already ingrained. But if we do not have the management bandwidth to take these innovations to the market and then take it to the global stage, I think we will miss the bus of medtech. We will continue to be medical, disposable, and consumable segment because, it's a cost arbitrage, nothing else, right? So I think we probably need to learn from our pharma story of generics. I think we continue to be strengthening generics, whereas I think we do have an opportunity to create novel, medical devices, and which we have already seen, trust me, like every third patent in India which has been granted is actually related to medtech innovation. But do we see like a Smith and Nephew of a company next 20 years from India? We don't see that, but it should happen. And I think such discussion, Pushpa, maybe the next topic of your SOCHAM summit could be around how India can truly become a medtech hub of India. And we don't even have a single medical tech company even listed. For that matter, I remember in Yes Bank when there was a company called OptoCircuit, and I don't even track it anymore because I don't think it exists now. Maybe Pushpa may have insights, but I think we need to truly have listed companies in medtech space in next 10 years. If we can do that, truly we will become like a resilient India, and I think we are not going to be dependent upon imports because 80-20 is a rule which I have been hearing for 20 years. And today also, in spite of doing whatever, you call it make in India, made in India, whatever, we are still dependent upon medtech innovation for the rest of the world. Rest of the world is doing, and we are just doing either copy-paste or we are importing it, nothing else.
No,
Rahul, you want to share
I
something?
think it's changing fast. You now have an India-made Linac, which is finding adoption, amongst some hospitals. You have other medical devices, consumables, yes. I mean, India has been big and it will continue to grow. But small devices and even Linac, and recently, 2-3 weeks back, there was a news around first India-made MRI machine, right? So hopefully it will take time, as you said. I mean, adoption takes time because old habits die hard. But I think there is interesting stuff happening and should continue.
No, I think, yeah, there's both ends of it. There's commercial momentum, but there's an innovation pipeline that's not gone to value realization. So hopefully, the commercial momentum will pull this forward and we'll be able to change that tide. But I agree on overall reflections. We've got a strong pipeline. That pipeline is kind of stagnant, so that's true. I'll turn to you, Chirag, for one final comment from you on the clinical trials ecosystem. We're sitting on, a very rich healthcare delivery ecosystem. Is there an opportunity to pivot, realize value in clinical trials, and you all have invested in that space? What's the trajectory of opportunity there?
So, while we've been speaking about healthcare delivery, about multi-speciality, one important outcome out of hospitals that get created in India is the ability to do clinical trials. For some of you who may not know this space, though it's been very popular post-COVID because you've known all COVID drugs that have gone through phase 1, phase 2, phase 3 trials. So this term has become common in the population. So that's a space which is sort of growing pretty quickly in India. Until 2010, India used to be actually a HubSpot of clinical trials. There were 500 to 700 clinical trials being done in India. Each clinical trial is roughly $2 million of revenue for a services company. So this market was closer to $1.5 billion. But at that time, we did not have as strong a multi-speciality setup as we have today in terms of infrastructure. We didn't have hospitals that had level 1 HIS. We did not have proper reporting of adverse events. Clinical trials are essentially dosing people with new drugs, whether for cancer or other therapy areas that have come globally, but Indians get access to them after many years. So if you're able to do clinical trials in India, as Indians, we can get quicker access to some of these drugs. After 2010, some of these clinical trials significantly dropped in India because of Supreme Court level interventions, which is you couldn't do a clinical trial if someone who had an adverse event was not compensated for their lifelong medical bills. Right? This was not feasible for a pharmaceutical sponsor. You couldn't do clinical trials. It would take 6 to 8 months for the regulator to give approval for clinical trials. So there was a 3-body committee that was sort of giving approvals for clinical trials. In 2018, what has happened is there were these new clinical trial regulations that have come in that have given sort of 3 pushes to the segment. One is 90-day, no questions asked approval for any clinical study that has to be done in India. B, a defined compensation. If there's an adverse event, the formula for a compensation to be given to the volunteer is defined. And 3, we have a network of your Apollos, your Medantas, your Maxes now, who have the capability and the investigators to do these clinical trials. So the clinical trials back in 2010 was 500-odd clinical trials, went down to 50 clinical trials, but last year we had 400 clinical trials in the country, and they're growing at 2 times every year. So this year we expect 800-odd clinical trials to be done in the country. So that segment has become like a significant growth area. It supports innovation in the country. Today, every pharmaceuticals country that you see all over the world is looking for sites in India to do clinical trials and is looking for hospitals in India to do clinical trials. As a country, we spoke about IT services, India having a generation of IT services in the past. To do clinical trials, India has all the ingredients. We have quality scientific talent. We have strong network of hospital sites. And someone spoke about the pharmaceutical landscape that has been created, the generic landscape that has been created in India. One offshoot of that has been a strong quality compliance. So we've had companies who have significant experience in US FDA audits. And that talent has also moved to the CRO industry. So from a regulatory perspective, we have sort of upped a notch from where we were a decade ago. So all those ingredients kind of play well for the clinical trial ecosystem in India. The cost of recruiting a clinical trial patient in India is half of that of what is required for anywhere else in the developed nations. So again, very bullish about that space. We're invested in a company there, and we're seeing significant growth in that space.
Thank you, Chirag. And also spills over into other areas of contract services, pharmaceuticals, access. I'll turn to Dr. Sunil Katrapal here. Sir, you're representing an association of healthcare delivery entities, so you have a voice of an industry with you. We've been talking about the government as a driver of growth, Ayushman Bharat mission, but we have a private sector perspective and investor perspective on this panel. So are you seeing more momentum around public-private partnerships? Is the private sector going to benefit more from the government focus? And are PPPs going to expand? And you're closely working with the government as an industry association lead on PPPs. So are you seeing PPPs expanding? will public spending impact in private industry growth further?
Yeah, thank you, Pushpa. See, I belong to the association called AHPI, Association of Healthcare Providers India, and we represent vast majority of the private healthcare institutions in the country. And we have 20 state chapters. And we are present across the country, 20 state chapters, and each state chapter is empowered with an executive committee, having a president, vice president, and a secretary, and the executive committee members. So our main objective is to achieve universal health coverage, of course, and we closely work with the government. We do advocacy and lobbying with the government, with the regulatory bodies, and with the other stakeholders to achieve UHC, universal health coverage. And of course, but when we talk of the public-private partnership, it is all about balance, making an equilibrium, and cashing on each other's strength. And the balance between the risk and the reward, and also balance between the cost and the impact. So this is something what is PPP model works on. And when we talk of PPP, the government, if you see the NHSRC report, there are different PPP models which they have adopted. And if you see in primary healthcare center, so PPP is not only for the primary healthcare center, but of course for all levels of healthcare, primary, secondary, and tertiary. So I'll just come to PMJY because that is a main, it's a very, very big, project. Actually, if you see, it's the largest insurance scheme in the world, and which is funded by the government. And if you see the funding pattern of PMJY, it is not solely central government funded, and it is 60-40. 60% funding by the central government and 40% by the state government, except for 3 states, that is Jammu and Kashmir, Himachal Pradesh, and Jharkhand, where it is 90% versus 10%. So, more motherly treatment to these 3 states, of course. I wish I should not say stepmotherly to others, but more motherly treatment. Yeah. So this is something, and if you see the areas where PPP models work, one is I said about the primary healthcare. This is primary healthcare model. There where you see the sharing of resources, the expertise, the specialist, which is the strength of the private players, right? So what are the strengths of the private players? These are the specialists, and of course this increases the efficiency of the system by deploying the specialists to the government primary health centers. And then other areas, mobile medical units, mobile emergency ambulance services, and institutional delivery of infants. And lastly, the strengthening of diagnostic services of health and wellness system. So if you see what are the objectives of this PPP models? Objective is, first thing is about availability, I mentioned, availability of the specialist. And second one is your efficiency, which I already mentioned. And then it catalyzes the healthcare inclusion and accessibility. So accessibility, availability, affordability, and last but not the least is quality. I do not say that, public healthcare is not, providing quality services, but there's a lot of work being done by the public healthcare system. NHSRC is doing a great work, about NQAS, the National Quality Assurance System by NHSRC. They also have their accreditation system. I'm also empaneled with NHSRC as an external assessor, external assessor. So this is something, the public system is again, they are working, they are also, if you see separately, they are doing well. But still, if we want to provide universal health coverage, if we want to meet all the components of universal coverage, we need to, public and private should join hands. And of course, most important aspect is when we talk of collaboration or joining hands, quality is very important, of course, but then, of course, funding part, finance part, which I'm not a person, to talk about, and I'm surrounded by all the investors and, we have talked about money and finance and everything, so I'm a misfit maybe in that.
Thanks,
But
actually.
anyway,
I'll-
Dr. Gupta is with me, so this is something, yeah. And of course, the main aim is to go scalability and sustainability. So whenever we do collaboration, we public-private partnership, the ultimate aim is to sustain that model. So sustainability is the key factor. This is what we are here for today, innovation and sustainable solutions.
Absolutely, thank you. I'll just ask you to comment on one additional thing here. We've been talking about scalability of digital innovations, and fundamentally it goes back to digitization of health records, which is going to be important for scalability of any digital innovation in the country. So can you also talk through what the government, what you're seeing, because you're very closely working with the government on advocacy. Is there today incentives from the government for digitization of health records, and do you see that as an effective mechanism to foster digitization of health records?
Right?
Yeah.
Okay. See, basically, you're talking of Ayushman Bharat Digital Mission. The vision of Ayushman Bharat Digital Mission is to that Ayushman Bharat digital ecosystem, to create an ecosystem of Ayushman Bharat digital ecosystem, and to provide universal health care by creating a data source. Because the main purpose of this Ayushman Bharat Digital Mission is to increase the accessibility part. And today, there are key building blocks, of course. We all know about ABHA, HPR, HFR, and also I have a drug registry. Just 1 hour back, I got a data from NHA because we work very closely with National Health Authority, and we support these two flagship program of the NHA, the PMJY and ABDM. We work very closely. So this is a very authentic data which is received at 1:30 p.m. today. So I'll just mention about, because it changes every second. So as on 1:30 p.m. today, the data is health facilities registered 2.17 plus lakhs, 2.17 lakhs. Healthcare professional registered 2.21 lakhs. And scan and share tokens generated 68.79 lakhs. Scan and share is like, on your mobile, you can, that code, what do you call that? QR code, you scan, and you enter your demographic details, and you are registered in the OPD. And then, healthcare professionals, of course, I mentioned, 2.21 lakhs. And successful partners, they have 115. This is ABDM has successful 115 partners, all tech partners and others. So huge. These are the building blocks of ABDM, and I mentioned about the key components and statistics. And then secondly, there's one incentivization scheme in Ayushman Bharat, which of course not many are aware, but you have to register. Even if you are a registered facility with Ayushman Bharat, HFR, but you need to register for the incentivization scheme. We call it Digital Health Incentivization Scheme, DHIS. So DHIS is over and above some particular, if you achieve a particular figure, then that incentivization is applicable. So this is again a great scheme. And 50 crores, 50 CR has been the budget for the DSIC scheme. But people are not able to avail it. So I discussed with NHA, I was there last week with the senior leadership from NHA, and we were discussing how to create awareness. And so we are also helping them. We are, in conducting webinars, and to our members, we have about 20,000 members hospitals, across the country. So that's how we work very closely. And
no, thank you. And it's actually a great measure because they're also focusing on integrating providers within that scheme. And overall, it's a great structure to foster digitization. I know we've run beyond our time, and we'll have to wrap up. I'd love to continue chatting with my friends on the panel. I'll turn to Rahul because you've been the most optimistic in terms of breadth of optimism to make one concluding comment, and then we will close.
I think, first of all, thanks for having us on the panel. It's been great. I think all of us as investors, builders, can only be optimistic for healthcare in India. I think the opportunity is really large. And the subject that we were talking about, which is innovation and sustainability in healthcare, on lines of innovation, I briefly touched upon in the beginning about how do we build about innovation, because what India has seen so far is the first wave of healthcare innovation with digitization of existing workflows, be it in terms of pharmacy, diagnostics, teleconsultation, but there is a bunch of clinical white spaces which require a lot of work. And building in healthcare is hard, so the intent for all of us on the panel and also otherwise for us at W Health Ventures is to build companies grounds up, for which we just launched a venture studio called 2070 Health, where we want to really build companies from scratch, provide operating support, provide capital, which keeps us optimistic for Indian healthcare. And thank you so much.
Thanks, Namit. Would you like to make a final concluding comment?
Yeah, I mean, as I said, we continue to be very positive. We only invest in healthcare, so there is no choice but to be positive. No, but on a serious note, I think very good times for any and every healthcare business. The payer pools, the user pools, I think you can see everything is maturing, both from servicing a domestic market and servicing an export market wherever there's that opportunity. Especially for products, right? Services will always remain localized. But again, we are seeing servicing companies also, healthcare service companies also now going to global markets, wherever there is an opportunity. So I think that appreciation for Indian healthcare services and products, both in the domestic market and export markets, I think there's never been a better time. And we only anticipate it to, grow further.
Thank you. I'll wrap up the panel here in the interest of time, but you've been a great audience. Thank you so much. Appreciate engaged conversations and happy debates. We will continue the happy debates as friends of the stage as well. Thank you so much. Appreciate it.
Thank you to all our speakers. We appreciate all your ideas and your vision for our healthcare ecosystem going forward and how it will grow from here on. I would request Mr. Sandeep Jain to please come on stage to present mementos to all our speakers. We are grateful to them for coming here and sharing the wealth of their knowledge with the audience. I request you to please present a memento to Mr. Chirag Sachdev, Principal CX Partners. A memento for Ms. Pushpa Vijay Raghavan, Director, Healthcare and Life Sciences, Sadhguru Management Consultants. A memento for Dr. D.K. Gupta, Co-Chairperson, ASSOCHAM National Digital Health Task Force and Chairman, Managing Director, Felix Hospital. A memento for Dr. Vishal Gandhi, Founder, Director and CEO, BioRx Venture Advisors. A memento for Dr. Sunil K. Khetrapal, Director, Association of Healthcare Providers of India, AHPI. A memento for Mr. Namit Chuk, Principal, W Health Ventures. And a memento for Mr. Rahul Agarwal, Managing Director, Quadria Capital. I request all of you to please gather for a group photograph. Thank you all for joining us. With this, we come to the end of the second Healthcare Summit and Awards 2023, Innovation and Sustainable Solutions. We hope these sessions have been very insightful and will help you tailor your healthcare solutions to fit the new age digital health infrastructure, whose adoption is likely to be swift and universal. We would like to thank our sponsors for their support. Indraprasth Apollo Hospital, Artist for Her, AMTZ, Sadhguru Management Consulting, CAHO, AHPI, Seven Hills Hospital, Akash Healthcare, Narayan Health, Sir Gangaram Hospital, Hiranandani Hospital, Healthy Soch, Innovacuris, and Medical Buyer. Till we meet again, this is your host, Anisha Nair Dhawan, signing off. See you soon. You can collect your delegate bags from the registration counter on your way out.